Pretty job.
Oh, that was nice.
I don't know, he was someplace, because I did call him this morning about the urgent task I had to do.
It's like there's-
What do you think?
Or is it actually? Another way.
A whole bunch of notes.
Wow. Yeah, it's like 3 minutes off.
Hi. How's it going?
Or that could be fast.
Stop it this time.
My watch is active.
You don't have your own. Don't know how long we're going.
And then over a specific.
Oh, thank you, this time? Thank you. I think it's good we.
You're under the wire.
I had a lot of. Oh, thank you. I just read it out. Yeah, 5, 10. We can order that.
Well, there's somebody who would like to have.
Yeah. But almost 60% of the folks opened it. And that's average opening is like, oh,
These are warm.
so people are. Yeah.
Call the meeting to order. We can stand for the pledge, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. All right, we'll go ahead with the roll call.
Commissioner Robbins.
Here.
Commissioner Walter.
Here.
Commissioner Bunnick.
Present.
Commissioner Wessel.
Here.
Commissioner Campbell.
Here and present.
Commissioner Elder.
Here.
Chairman Yoder.
Here.
All present.
All right, thank you. So, all right, somewhere we got a phone too close. There's some feedback out there. All right, next up, we have approval of the agenda, late additions. Looks like we got a few items to add here. Wanted this straighter.
Three that we are considering would be the appointment of the MERS delegates, the users conference for emergency management.
Could you speak up more? I'm sorry, it's hard to hear you.
Oh, that wasn't even on. There we go.
Thank you.
Yeah, the three items that we'd like to add would be the designation of MERS employee and officer delegates for their conference in October 2025. A out-of-state travel authorization for the director and assistant director of the emergency management department to attend the conference in Indiana at Notre Dame University. And then the third item would be adding a discussion regarding the early childhood modifications discussed at our last meeting. And I think they could be added as items G, H, and I to Administration, number 6.
I would move to add items G, H, and I to the agenda.
Motion made, supported. Which one did you have for G again?
I would say it would be the emergency management travel authorization, the MERS delegate would be the next one, and the final one would be early childhood.
All right. Any discussion on that motion? All right, if not, all those in favor signify by saying aye.
Aye.
All opposed, say nay. Carried 7-0. All right, next up, we got communications, Got an administrator update.
I wanted to start with provided you a written, full-page written report that discusses a number of issues that we've been presented with over the last 30 days. The intent of this report would be to give you information regarding things that may be coming up in the future or resolutions of things that we've done in the past 30 days. I will be providing you a copy of this at the executive board meeting because a number of these items are suggested for discussion, as I said, in the future. The only item that I want to provide an oral report on is our Blue Cross Blue Shield status. And let me find my right item here. What you've asked us to provide over the course of the last couple of months is a review of our employer paid health plan. And just briefly, so the public is aware of what it is we're talking about. The county does not have a traditional plan where we pay a premium and then benefits are provided to the staff. We have what is commonly referred to as a partially self-funded plan, where we pay the actual costs of providing the doctor's care, hospitalization care, and medications to our employees. And those claims are administered by Blue Cross Blue Shield, but we don't pay a traditional premium. What we do pay to them, in addition to the cost of the providing medical care itself, we pay to them what is called a stop loss premium. And that pays back to us. We pay a set fee, and then Blue Cross Blue Shield pays back to us any costs that we're obligated to pay in excess of $20,000 per contract. And that applies to a contract regardless of whether it is an individual, a dual contract, or a family contract. And you can imagine that $20,000, particularly in light of current prescription costs and medical care, doesn't necessarily go a long way. We've had this program in place for a number of years, dating back, I think, to 2013, 2014 or so.
2009.
2009, and it's been quite a while that we've had this program. We maintained a consistency of the stop loss amount of $20,000, and our consultant has suggested to us that that's been a good number for us because we've been able to maintain cost consistency over all those years. The difference is in the last 3 years, we have experienced since 2022, we've had 17 instances where contracts exceeded $20,000. In 2023, that amount increased to 24 contracts. In 2024, it was 29 contracts. In 2025, with 4 months of data, we are now 12 contracts exceeding $20,000. So we would expect at least 35, 36 thereabouts of those contracts over the course of the full plan year will exceed the stop loss. In addition, for the years 24, 25, 2024 and 2025, we have received more in stop loss repayments than we have received in stop loss, or than we have paid in stop loss premiums. And we're expecting that will also occur this year and this plan year as well. So it's the bulk of the cost of our plan lies in the premium that we pay for that stop loss. That's risen from a low of $400 per contract to now $1,244 per contract. And we expect if we have a third year, because that stop loss premium is based upon a rolling 3-year average. And if we have a fully 3 years of having claims exceeding premiums, it's pretty clear that Blue Cross and Blue Shield will raise that premium to a cost prohibitive level. The good news that we have, or we've in reviewing the data, is that the cost of dental, vision, hospitalization, and physician care has remained relatively flat. It's not increased significantly. The real focus of our cost, the cost increases that drive a contract to exceed $20,000, you would think it'd be hospitalization, but it's not. It's prescriptions. We have numerous prescriptions where it can be as much as $80,000 for a full year's worth of the prescription care the person receives it for the entire 12 months of a planned year. So again, the good news is we have cost control in most areas other than prescriptions. So we suspect that we're going to be looking at the end of the plan year, which we typically renew, I believe it's in January or February. It doesn't coincide directly with our budget year. But during our budget process this year, we'll be looking very closely at whether or not there are any changes that are going to be necessary to that plan. Some potential options could be increasing the stop loss trigger to a higher level of something beyond $20,000. Obviously, that increases the potential risk that you incur if you have approximately just under 100 contracts. If you increase that, let's say you increased it to $30,000, that would add a potential risk of about an additional $1 million worth of healthcare costs before the stop loss would kick in. That is one possibility. A second possibility would be the adoption of a tiered drug co-payment plan. Currently, our co-payments are $10 for generic and $40, I believe it's $40 for non-generic or specialty medications. Typically, when you adopt a tiered drug plan, it's intended to encourage people or incentivize them to switch to a generic drug. Now, in a number of these cases, the high cost drugs, there is no generic equivalent. So that may or may not be of some assistance, but that's something that we can consider. A third possibility would be benefit modifications, where some of the things that we currently pay for, we just won't pay for in the future. That's a possibility. And the fourth obvious potential change would be partial employee contribution. Right now, the cost of insurance is 100% borne by by the county. So that is a potential source of reducing our costs. And what I indicated in the written report, we would also very likely need to adopt a resolution to waive the so-called hard cap on insurance benefit payments. There's a statute in Michigan that provides that a municipality cannot pay more for health insurance than a specific capped amount. And we anticipate that in the next plan year, we will almost certainly be in a position where we'll exceed that amount. So you'd have to either waive that or adopt a program where the employees pay 20% and the employer pays 80% of the cost of insurance. And then there is no limitation on what you can pay. Or again, the three options: you adopt the hard cost, the hard cap, and any additional is paid by the employees. You can agree to an 80-20 plan and then the cost is not capped, or you can waive that cap, which is I would anticipate if we continue on in doing the same thing we've done in the past, we would be required to waive the hard cap. That's the broad strokes of what we're looking at. Our intention of providing this report today was to give as much information as we possibly can to you as you consider the budget in 2026, but more importantly, to let the employees know what's going on, so they are not surprised in say December of 2025 that we're going to suddenly make some change to their plan that'll be in effect within the next 30 days. We anticipate having employee education and feedback sessions throughout the balance of this year to get feedback from them as to if we do need to invoke any of these options that I've outlined, that they can have input into which of those we do adopt. That's pretty much the presentation regarding our health insurance status, and I'd be open to any questions that you might have.
Yeah, thanks, Jim. How do we work with the unions with the contracts, and is there an implication there, or is this outside of the contract?
It's not generally it's not outside of the contract, but typically the contracts indicate that will provide the benefits that we're responsible for providing those benefits. It doesn't necessarily indicate what those benefits are.
When we first heard from the insurance rep, he talked about meeting with employees to discuss some of the problems related to increased drug costs. Has there been any of those meetings?
Not yet, but that's what, again, that's what we were anticipating doing as a result of this review. In addition, you'll recall that at your last meeting, you adopted what's referred to as the Pillar program, and that is a program that encourages those that are on high cost drugs to move to a lower cost drug, and that process is starting right now. You approved that last month, and I think if my memory serves me correctly, it's about a 60-day lag time before that actually is fully implemented.
Yeah, I would think that the sooner those meetings can begin, the sooner we can start working on that curve.
Yeah. Any questions for the administrator? Yeah. Everything for beyond the written report, yes.
All right. Next Next up, we have our area aging in Northwest Michigan. Anthony?
Morning. Hopefully Lauren will get the presentation up on the screen. Maybe. Just want to thank everybody for the opportunity to provide our aging update for 2025 and introduce Candy Lannon. She is the Executive Director of Area Agency on Aging. Our region is 10, and she's going to share her annual report, and then she'll move into the Leelanau County statistics. And then I will take over from there and present on Leelanau County Senior Services.
Thank you. Good morning, everyone. Next slide. Thank you. So many of you probably have heard of the Area Agency on Aging of Northwest Michigan. We've been in front of you in the past. We are a private nonprofit covering 10 counties, governed by a board of directors. Commissioner Allgaier is one of our board of directors, and we're happy to have her represented on our board. Area Agencies on Aging were born back in the 1960s out of the federal legislation for the Older Americans Act. And so we receive dollars through the federal government and then also through the state government through the Older Michiganians Act. And with those dollars, we do many different things. One of the things that we do, and this presentation, the PowerPoint outlines highlights from our annual report from 2024, but you also have in front of you the full read of our annual report with all the additional information that I'm not able to cover today. So with some of those dollars, we contract those out to the local communities, providers, oftentimes a commission or council on aging with those dollars. And as you've seen in the past, there's a local match request that comes from our organization to each of the counties in the region, so the 10 counties, and it's based on a funding formula. That amount hasn't changed since 2012. So again, this year we recently sent a letter to the Board of Commissioners for $4,186. I bring that up just to share that some context around that request. We're required, in order to receive the federal and state dollars, we're required to have a match. And so we reach out to each of the counties that we serve to help contribute to that match. As an example of the dollars that then flow into Leelanau County and serve the seniors and the caregivers, just looking at one program alone, so the Meals on Wheels or the congregate meals, there's projected this year to be about 20 to 22,000 meals served collectively between those two, congregate and home delivered. And that would be roughly over $175,000. And that's just for one program. So there's many other programs outside of that bring funding and resources into this community. But again, I just wanted to touch on and give you a brief kind of overview of how that match contributes and helps us to bring more dollars here. So you can see the contractors that we work with around the region. And this is, again, just one contract type. I'll talk about another contractual arrangement that we have that bring additional dollars. But on the next slide, this really gets to the heart of the participants. So the number of participants and units, which could be a meal or an hour, that are served region-wide, so throughout the 10 counties. Our largest program that we fund by far is the Senior Nutrition Program. And you can see over 535,000 meals throughout the region in 2024. That's feeding a lot of people, a lot of vulnerable older adults and caregivers. If you go to the next slide. With the funding that we receive, we hold back a little bit. Most of the funding we contract out, but we are able to hold back a little bit of the funding to do programs and services that the local agencies typically historically have chosen not to do for one reason or another, or we complement the services that they're already doing. And so two of the largest programs that we have are the care management and My Choice Medicaid waiver programs. They're case management programs. So we have nurses and social workers that go out into the homes, do assessments, create person-centered care plans to help bring services into the homes of individuals that are medically at risk. So either they're really close to needing nursing home level of care, or they qualify already for nursing home level of care. The care management program is not means tested, whereas the Medicaid My Choice waiver program is you need to qualify for Medicaid. It's not community Medicaid, it's long-term services and supports Medicaid, so the eligibility is a little bit different. But through that program, we also then contract out additional dollars that we receive. Some of them are through the Older Americans Act dollars, and some of them are Medicaid dollars. So about 70% of our revenue is from Medicaid, and the 30% then is from other state and federal sources through Older Americans Act. But what I like about this slide is in all the bubbles, you can see the person is in the middle because that's where we start, being person-centered. But then within those bubbles, you can see the different services that touched the different individuals that are in our programs. And so you have people from Leelanau County represented in those different bubbles getting services. We work very closely with Leelanau Senior Services to provide referrals back and forth. And so we're not duplicating our services in the homes. We're complementing each other and working closely on those various needs that the seniors have. And one of the services that we do directly is information and assistance. And so we have social workers that man our phone lines for any calls that come in from across the region, people that have questions on food, housing, needing support in the home, you name it, we get a call. Transportation, they come through us. Majority of those calls that we take, we refer them back out to the local provider. So in this case, it would be sending referrals over to Leelanau Senior Resources to work with those individuals locally. And then if there's things that we can do to complement what they're already doing, then we work together to do that. We also have a long-term care ombudsman. He also works in Leelanau County, but covers the full region. And the role of that person is to go into any licensed facility. And if there's a complaint, if a resident's not feeling heard, like they don't have a voice, he's in there to be kind of that mediator to help resolve any conflicts, any issues. And it's a very, very important role that he has. He also helps on elder abuse prevention and awareness. So he has a lot of responsibility when it comes to working with the older adults, especially being vulnerable in an institutional setting. We have a housing specialist, which is a critical need right now. So in particular, though, they work with those that are on our two programs, care management and My Choice waiver, to make sure that they're able to continue to receive services in their homes. Over 90% of older adults, that's where they want to age, is in place rather than an institutional setting. And so that's how we can help support people to be able to maintain either their home or be in a home of a loved one. We have a Medicaid assistance specialist who helps with the Medicaid eligibility for the My Choice Medicaid waiver program. And then also a Medicare counselor, and we provide the regional coordination for the Medicare counseling and work closely with Leelanau Senior Services with their Medicare counselors. Next slide.
2 slides.
Oh, did I miss a couple?
Yeah, that's okay. One more slide.
Yeah, thank you. Okay, now I want to talk a little bit about the trends that we're seeing in the population across the region, and then I'll specifically talk about Leelanau County. So across the region, what we're seeing is really steady growth, probably no surprise to any of you. It's kind of a steady growth over the past 5 years that we've seen, and it's driven largely by people moving into the area. So either they're retiring or remote work has really increased since COVID. And so we're seeing a lot of people come into the area due to that. The aging population, so most of the counties in the region that we serve about 25 to 35% of their population are 60 or older. Leelanau County by far has the highest concentration of older adults with 42%. And we're seeing that because of the shift with the aging population, there's really, it's shaping, or it needs to shape the local economies, the healthcare system, and it's definitely having an impact on the demand for housing. So to talk about the retiree and remote work a little bit more. So we're noticing that Leelanau, Grand Traverse, and Emmett counties in particular are really, as you know, they're very attractive communities. And they attract the retirees, the remote professionals, because of their natural beauty, the quality of life. One thing that we've seen impact this substantially is more access to broadband internet, making it more possible for people to be able to work remotely. And so especially people coming in from the more urban areas to live up here. So what does this mean for planning and implications on our economy? Several different things and challenges that we'll be facing region-wide, but I know for you, especially here in Leelanau County, healthcare and senior services, being able to staff those different services. The direct care workforce is shrinking. So as the aging population increases, the younger population is decreasing. So who's going to take care of us as we age? Maybe we have family, maybe we have neighbors, maybe we don't. Who's going to serve us as we age? Workforce development is shrinking. There's a lot of efforts going on to bring that back in terms of how can we support direct workers. But we're seeing a lot of people want to get out of the field of hands-on care. It's not a flashy field to be in, if I could say it that way. There's not, typically the wages aren't what you would see in other fields either. And so what can we do to help support people wanting to come into that field and get them going at the younger age? And then housing availability and affordability is another huge one. And we're talking about that region-wide and what we're seeing. So affordability is subjective. As you know, what people can afford, older adults on fixed incomes and so forth, and then the accessibility of the home and the different rental properties. The other thing that we're seeing is people that want to age in place, they might not have resources to be able to maintain their home. Who's going to change their light bulbs? Who's going to do these everyday maintenance things to help them stay at home if they can't afford to pay somebody to do it? And so we're seeing a lot of that and trying to be planful about putting different systems in place so that we're ready to be able to support the aging population and their caregivers as it continues to grow. And then we go into, on the next slide, we're going to look at some of the population data. Leelanau County is on here, and I just thought it was important for you all to be able to see the region that we serve. And you can see there that Leelanau County is at the 42%. More aging, affluent population. And you can then look at the other counties that we serve. Some have slower growth, like Meskwaki County. And these are based on the community needs survey and some of their findings. Next slide, please. And the next one, please. Okay. So with the growing and aging population, looking at some of the statistics from 2013 all the way through, or 2015 through 2023, we don't yet have the data for 24 and 25. But you can see that by in 2025, by the end of this year, it's projected that Leelanau County will exceed 23,000. And within that, that's showing a steady growth of 8% over a decade, approximately 8%. What is, I think, really interesting, though, is when you piece apart and you look at the older adult population, that 60+ population. So that was back in 2015, about 37%. And when you look at that now, in 2023 at least, it was 42%. I'm really curious, as you may be, what that will look like now when we get the reports for 2025. So this segment has grown over 1,500 people in a relatively short amount of time, 8 years. over the span of many, many years is relatively short period. So it reflects really a broader trend that we're seeing in the rural and retirement friendly regions. And Leelanau is definitely becoming an older retiree area where people want to age in place. But how are they going to age in place in Leelanau County? Who's going to be there to change their light bulbs and be able to help them maintain their homes? So if you can go to the next slide, I want to talk about adults in poverty, specifically the older adults. So overall, though the population in poverty in Leelanau County has bounced around a little bit, as you can see by the bottom table, there's still a downward trend. So poverty over in the overall population is going down. But when you piece that apart and you look at the aging population and poverty, you could see that those in poverty have more than, it's increased more than 100% in 8 years. So from 3.7 now to 6.3, and that was only as of 2023. So this trend is really critical to keep an eye on. It suggests that Leelanau County really is a hub for older adults, and a growing share of them are struggling economically. Possibly due to healthcare costs, as we heard this morning, costs are rising, but also fixed incomes not keeping pace with inflation. But then you also have a lack of affordable housing again and services. We talk about transportation and service providers that are willing to go in there and do services to help people stay in their homes. The next slide is it's just giving you a visual of that increase, that upward trend in population and the poverty levels. Overall, even outside of Michigan, there is, the nation really lacks a strong system for long-term services and support. It used to be many years ago, as I was growing up, I used to think, you know, you live your life, as you get older, then you go into a nursing facility. That's just what I thought. Now being in this industry for many years and knowing all the different programs and resources, obviously that's not the case. You can live your life, you can age in place, but you need to know of the opportunities available for you to be able to do that. Many people think that Medicare pays for nursing home care. Does not. So you rely on private pay, extremely expensive, some over $10,000 a month, or you are Medicaid eligible. So there are people that have dollars, but they're stuck in the middle. They don't have enough to pay for a nursing facility for very long, maybe 6 months, maybe a year, but they have to spend that down and then, move from the private pay to then being Medicaid eligible. And that's a big swing from being able to private pay to then all of a sudden your lifestyle has changed and you're Medicaid eligible. Many people just don't realize, again, that Medicaid is the only insurance that will pay for that long-term care unless you have a private long-term care coverage. So there's this huge gap where people fall. That's where some of our programs come in, like the care management program that's not means tested, but there's limited funding for that program too. And so it's really thinking about, it's not that we're talking just about the poorest of the poor that we're serving. We're talking about those that have multiple chronic conditions. They're not able to care for themselves. They need the type of care that you would get in a nursing facility, but that's not where they want to age. So how do we wrap around them and keep them in their homes? I want to just end with one more slide, and it's kind of talking about the future and what that could look like. So even though, again, there's not the poverty level data, it is projected that with the population reaching over 23,000 for Leelanau County, probably the 60 plus is what's being predicted is going to exceed 10,000. We know that's going to happen eventually, sooner rather than later though. And then if that trend continues, then the number of adults in poverty in Leelanau County will surpass 600. Unless it's mitigated with different policies and support systems in place and different programs. So really the story of the data and that I'm sharing with you today is that as a rural area, your aging population is growing extremely fast, which again, I know that's not new to you. I know that you know that, but it's really, it's talking about the challenges that the county will face in the coming years, and you're probably already facing some of those now. But it's about, how can we support those that need assistance? Those that maybe fall through the gaps of qualifying for some of the Leelanau Senior Resources programs because maybe they're just outside of that eligibility. But maybe they're not in the higher cap that they can necessarily afford to private pay or meet a sliding fee scale or those types of things. So how can we be creative and extend some support to them also? And as that older adult population increases, then, how can we make healthcare more accessible, transportation, social services? Each county, I feel like, looking from the outside in, is so fortunate to have a commission or council on aging. Not all counties in Michigan have one. And then also to have a local millage for seniors is extremely valuable because the funding we get does not, as you know, fully pay for the services that come into the counties, but we're one arm of the funding that help the programs to be able to exist. So that is my presentation, all of my information. I'm happy to take questions after Lena is done or whenever you would like.
Questions with hands right now? Or move on to Lena?
What's the impact of the projected cuts in Medicaid for 2027?
So far, we have not heard how the Medicaid that we have is very specific for older adults. So it's outside of the community Medicaid. What we're hearing in our network so far is the Medicaid for older adults in that population will be unaffected unless there are people that are currently in the system that are not US citizens. I will be on a phone call today at 2:00 to learn more about some of the details as things kind of devil's in the details as we're starting to learn more. And I told Commissioner Allgaier that I'll share that information with her. At this point, we've not heard that the programs that we serve, that there's going to be any cuts. But that's yet to be determined. For a little while there, we thought the ombudsman program was going to receive some cuts, maybe be eliminated, and that was walked back. We also heard that about the supplemental nutrition assistance program. But what I've heard as of late was that wasn't going to be touched either, at least when it comes to, again, those that are truly eligible to receive the benefits. Yeah.
Yeah, I was just wondering about, you talked about aging in place. How do the property taxes, because I know there's this thing out there about Axe My Tax. How are property taxes affecting the elderly, because as they go up, their income isn't really going up following it? Or does that really, do they have to lose their home, or is it talked about there were 140 foreclosures, last year in Michigan?
As far as I understand, yes, it would definitely impact them because it reduces the amount of income that they have. So their ability to purchase services, if they don't qualify for services through Leelanau Senior Services or through our organization, as an example, there's very few programs out there that are free to be able to support them unless they're Medicaid eligible. So they're going to probably over time, if they're paying property taxes that they cannot afford, it's going to dip into any of their, let's call it their savings, retirement. And over time that could lead to them losing their housing. And that's another with those, with people going into foreclosure, then what happens to them is they go into that pool of people then that are homeless and looking for that affordable, accessible housing along with everyone else that's in that bucket. And so it's making that, it's contributing to the housing shortage, definitely. Yeah. Yeah.
On the other hand, the taxes we pay support services. So if we don't support any services, they go away.
They do, absolutely. And they support the services, again, for those that are eligible for the services, definitely. And without the senior millage, the area would definitely have greater impact. There's other, like I said, there's counties throughout the state that don't have a millage and they really struggle to get other types of grants, usually one-time grants. And they don't want to, many organizations don't want to fund one-time, more of the administrative. They want to fund programming that's sustainable and has a plan for ongoing support and services. So the senior millages definitely a benefit to this community.
Yeah, well,
I just wondered on page 10, the older adults in poverty, is that for the region or is that for Leelanau County?
Do you have a page number?
It's- Yeah, mine says 10.
Leelanau County specific.
We're so hard to put in a box, but when I look at the future of the county, the points that you make that stand out to me are who's going to mow the lawns, who's going to take care of folks. You mentioned this dynamic that we have a growing senior population, and we are also the most affluent. Frankly, a lot of the need is, well, most of the need is for people who can't afford it. And so there's a buffering effect, if you will. Folks who need help, we gotta help. But there's two sides to that, and being affluent hurts you as far as affordability of homes, as far as folks needing government help. And it also helps you in that a lot of folks have their own means and are not in dire straits for the money side of it. They need to find the services to help them. And the only other point, and I'm not trying to detract from the mission, but I believe that the numbers come from the federal government. And when the federal government tallies poverty, it does not take into account government services that people provide. So sometimes that's difficult to really ascertain if people are receiving services that take them up to a certain level. They're just not included. But we know our people, and we know who needs help, and the senior services does a great job of recognizing and hearing, because we're kind of a pretty tight community, who needs reaching out to. I give you a lot of credit for that. Thank you.
All right.
All right, Lena. go
Sure.
for it.
Next slide, please, Lauren. So who are we? We have been serving seniors since 1975, and we're funded through a county millage since 2002. We serve a wide range of seniors, from those who are healthy and active to those with chronic conditions, those with cognitive decline. Our experienced team of 4, yes, we are a small office. We have 2 care coordinators. Gail Carlson has been with LCSS for just shy of 4 years. And then Mary Nelson, who I hired in January of this year. Both Mary and Gail do a wonderful job. As care coordinators, they attend educational forums. Both of them lead separate support groups in our county and into Traverse City. Gail particularly leads Parkinson's Network North as a co-facilitator, and Mary Nelson facilitates a Alzheimer's support group virtual for caregivers through the Alzheimer's Association. And then we have Armanda Krantz. She is our account clerk. She has 12 years of service with the county. Everything that you hear me talk about is because of our staff. They're our greatest asset. They're the ones that are behind the scenes, finding the resources for our seniors who need them. And it's because of their hard work and dedication that we are where we are. I'll talk about our in-home services and financial assistance program, which are income and asset tested, along with several other programs that are available to all Leelanau County seniors. And then I'm going to share a story with you about how we connect seniors with different programs that we're associated with. Next slide, please, Lauren. So we serve seniors who are 60 years and older, who are full-time residents of Leelanau County. 2 of our programs are in-home services and financial assistance are based on need. And we do that through income and asset testing through our office. An in-home assessment is required for all in-home services, things like personal care, homemaking, medication management, and respite. And those who are eligible for in-home services fall at or below the 250% of the federal poverty level. In 2024, we served 75 seniors. Of those 75 seniors, 45% have 2 or more programs in place. So they're receiving homemaking along with respite or personal care along with respite. So it's more than 2 services in the home. Over the last couple years, compared to where we are at this year, we have seen about a 10% decrease in-home services, but the year isn't over yet. And you'll hear in a little bit the unpredictability of who walks through our doors. Our financial assistance program is available for those who are at or below 200% of the federal poverty level. So things like heating and utility bills, we can pay for that, relieving maybe more money to pay for property taxes to help keep them in their homes. So that's when we can kind of talk about how can we help people age in place and stay at home. You see the list under approved unmet needs that we can help relieve money to pay their property taxes so they can pay their taxes by us paying heating and utility bills, safety related repairs to car, home. If they're uninsured, help with dental and vision costs and unpaid medical bills as well. Not approved unmet needs, we do not help with rent. There are other agencies that we can get seniors in touch with, like LCN, Father Fred, that can help with rent. And then we do not help with funeral expenses, vet bills, and repairs to washer and dryer. We do contract with Leelanau Family Coordinating Council for laundry services, so it is available to seniors that are in need, free of charge for them. And then we do not help with cable or internet bills. In 2024, we had, I can't see that number, 132 seniors apply for financial assistance. Of those 132 people, 114 seniors submitted bills to us throughout the year. So not everybody who applies finds themselves in need, but they're prepared and associated with our office to when they do have a need and a need that they can't fulfill, they do come to our office and submit bills. Next slide, please, Lauren. So our staff acts as community connectors. We often meet seniors where they are, and that does not happen in our office. Our care coordinators are out, boots on the ground. They meet people in their living rooms. They meet seniors in their on their porches. We've met at LCN before. We've met at churches. It's wherever they feel the most comfortable that we can meet them. We provide more than just direct services. We offer guidance and support and navigation to this web of aging resources. I want to share just a story with you. In the spring of 2023, a community member had put us in touch with a senior who had food insecurities. And we started delivering food from Leelanau Christian Neighbors on Tuesdays. After their pantry days, we take the leftover food and distribute it. Through that consistent once a week delivery of food, we were helped to fill a basic need, but also it opened the door to seeing more needs, more urgent needs. So as time progressed, this individual over the last 2 years has moved 5 times. Does not have stable housing. We have stepped in, we've helped pay utility bills for this individual. We referred them to Adult Protective Services, And we coordinated with Community Connections, NMCAA for homelessness prevention. And we connected them back with LCN and Meals on Wheels to help fulfill some of their basic needs like paper products, food, things like that. Today, we're currently working alongside APS to help secure housing for this individual. As we all know, this housing is an issue for a lot of our seniors and other people as well. So in this particular case, we made 9 referrals to outside agencies for this individual, and we activated 3 internal programs. It took us 1.5 years to build this trust with an individual, build a relationship. And when this senior needs help, we are their first call. So just building that trust and relationship, we serve as a safety net for our seniors that are in need. And our team is proud to act as the connectors and make those connections with our partners. Next slide, please, Lauren. I want you to take a look at this diagram. When we talk about aging in place, this is what our office and in coordination with other services looks at what the process looks like. It's not one single program. It's a system of interconnected services and support. So if you look at the first box, the proactive planning and prevention, this begins with putting the individuals and their families in charge, making decisions before crises present themselves, making thoughtful decisions. So things like our wellness program in partnership with Share Care of Leelanau, we're providing our seniors with the tools and education in regards to aging in place. Professionals like Bruce Barnes, our Medicare counselor, is assisting seniors to work through the web of Medicare. We do partner with Courtney Marshall Crocker from Marshall, Bruce and Law Firm, who provides free consultations for estate planning. And then our family or probate court also provides attorneys to seniors who are eligible for drafting medical directives and different estate plans or powers of attorney. The next piece to this is the access to community resources. To age in place, you have to have access and you need to know what resources are available. So everyday essentials like meals, access to food pantries, transportation, medical equipment, and housing options are all important pieces to this puzzle. These services are often delivered by a patchwork of service providers, and it takes coordination and funding to be able to connect all those dots. Programs like Area Agency on Aging, NMCAA, Meals on Wheels, LCN, Beta, Share Care, and our financial services through LCSS often bridges the gap between somebody being independent and vulnerable. And then support and social networks. One of the biggest threats to aging well is social isolation. Seniors need neighbors, they need community, and they need social opportunities. So programs that support caregivers, provide respite, and connect people with their community are all necessary pieces. And then once you understand all the resources, you move into the activation of your plan when needs arise. So things like in-home services, foot care, medication management, and care coordination are all pieces to that puzzle. Home and based community programs through Area Agency fits into this picture. So we can keep seniors in their home in their place of choice where they would like to age. So this diagram just shows how we are the connectors and the navigators of this web of aging resources. Next slide, Lauren. So this slide highlights a lot of most of our programs in 2024. So Bruce Barnes, our MAP counselor, served 246 seniors through Medicare counseling. Meals on Wheels, we did home delivered meals delivered to 134 seniors. Our wellness program through Share Care of Leelanau had a successful first year in that we were able to provide our seniors with resources and education about aging in place. We had 134 seniors attend 24 wellness programs throughout 2024. And then our weekly deliveries from LCN, we served 114 seniors and 615 bags of food. And our newsletters go out bi-monthly, which reach about 6,400 households in Leelanau County. In 2024, we did serve 1,362 seniors. And one of our programs that's available to all seniors in the county is transportation for medical appointments. Share Care did majority of those transportation requests at 84%, and Comfort Keepers did about 13%. And we do provide beta passes to those who would like to use beta for medical appointments or any appointments. And that is based on income and assets too, if we provide that. Next slide, Lauren. One of our challenges that we face is the unpredictability of the population we serve. During the winter months, we have a lot of new applications coming through our office for financial assistance for heating and utilities specifically. But today we see a lot of families come through our doors when they make a visit to a loved one, seeing the need and they need resources to help connect their loved ones to age in place. Demand for services is always fluctuating and it's hard to predict year to year. In 2024, we came in with the total expenses of 1.19 million. Coming in under the approved budget. We did utilize $23,000 of our fund balance in 2024, but nearly 60% of the expenses were paid for services and programs for our seniors. Today, 100% of our millage funds covers 94% of our budget. The other 6% is funded through expo booth, senior expo booth fees, contributions, donations, and our voucher program, which brings in some revenue. And then we do plan to use about $36,000 of our fund balance for 2025. Next slide, Lauren. So our seniors are facing real increasing challenges, as you heard Candy talk about as well, including housing, transportation gaps, caregiver burnout, and economic disparities. I just have one ask, that you check on your neighbors, you help them connect to our services, and you help us be a voice for awareness to help remove barriers and create access to programs for our seniors. Thank you. Any questions?
Thank you both for all you do, because you are for critical help when we all grow older. So that's very, very important. I have one suggestion. I think paying for internet would be important. you can have a virtual visit with your doctor and not have to go there. There is so much that people can do now on the internet that keeps them from having to get a ride or get in a car and drive 30 miles, making appointments, paying bills, doing all kinds of things. So I think that would be an important thing to adjust.
Okay.
Just a couple of technicals. Leelanau, the senior services wasn't listed as a contractor. What's that relationship or what's going on there?
Yeah, maybe you can explain it a little bit more, but so we make referrals back and forth. So
Sure.
we contract a lot of the contractors that other counties that area agency contracts with has their own staff to provide caregivers in the home. We contract out for caregivers. So we
Oh.
contract out with comfort keepers to provide our in-home services. So really our relationship looks different than it does with other counties because of that. So they're there to help fill the gaps that our services alone can't fill and act as other resources that we can bring to the table to help our seniors and their families.
So it's kind of a pass-through thing rather than contract Leelanau to contract someone else, just go right to the source through Lena's recommendation. Okay, see, I had one. Oh, can you explain the relationship between your department and Leelanau Christian Neighbors? Do you guys have a contract? Maybe I should know that, but I just don't. I know you guys
Sure.
work very closely, and I think that's pretty cool. You're working with a nonprofit, but contractually, I wonder what's going on.
We do not. During COVID, and this was before my time here, how I understand is with the food insecurities and they weren't able to bring people to the pantry, that they used, our office was making a lot of deliveries, especially with the commodities that are delivered through Leelanau Christian Neighbors. We were getting those to the doorsteps of our seniors. Today, what that looks like is on Mondays when they're open for pantry days, they have leftover food, lots of produce that doesn't freeze well. So they send us a text message Monday evening saying we have leftover lettuce, Bardenhagen strawberries the last several weeks that won't keep for a couple days. So we pick it up Tuesday mornings and we deliver it to the people who are on our radar for food insecurities. Typically it's those who have been through the income and asset testing, who don't visit the pantry themselves on Mondays or are homebound.
Thank you.
Mhm.
Also, Meals on Wheels for us comes from Northwest Michigan Action Agents. Yes.
Yes, and you'll hear from Lisa. Will be presenting next week at the regular session. Lisa Robichek, the director of Meals on Wheels through NMCAA.
All right. Thank you.
Thank you.
Thank you.
All right, next up, we are up to our first public comments. You have 3 minutes that are agenda specific to address the board. Do you have any members of the public that wishes to address the board? Mr. Rapowski?
Good morning. Browsing through the e-packet, I found some things that we'd like to comment on. 6C, Parks and Recreation Mission Statement. To us, it seems that the second sentence of that new mission statement is redundant. But we have further question, and that is, why do we spend money on parks, and for Leelanau, for whom are the parks? for ourselves and our Leelanau County people or the tourists. It'd be good to know that. 6D, waiver of attorney-client privilege. To us, it seems that all information, legal opinions that affect the taxpayers should be immediately distributed to everybody as quickly as possible, so best possible decisions can be made. Ordinary people wonder why such long delays occur in passing on this critical information. 6E, Leelanau County spending taxpayers' money on housing. To us, it appears that commissioners are being stampeded by various officials, including county officials, to spend taxpayers' money to subsidize housing for mostly everyone by the addition of a new term, attainable housing. But we never tell the people how that's defined. But that means mostly everybody. So we're going to run out of taxpayers pretty soon. Michigan law 46.11 does not mandate counties to provide housing. Leelanau County electors have not lawfully petitioned for the county to finance housing with taxpayers' money. Thus, when commissioners are forced or force themselves to spend even 1 minute at meetings discussing this broad-ranged housing matter, it costs taxpayers lots of money all the time at every meeting. Thank you.
Anybody else that wishes to give public comment? Kathy?
Good morning. My name is Kathy Dawkins. I live in Leland Township. I'm making public comment regarding action item number 1, which is the flock safety program. As a former law enforcement officer and investigator, and now a private citizen, I have several concerns about this program. I did some research on this last night, and this organization, this business started in 2017. They started out with law enforcement, criminal justice agencies with the use of collecting data on license plates in certain locations. Since then, they have expanded their operation to private people, businesses outside of criminal justice agencies. I want to know what safeguards, if the county chooses to do the trial run, I want to know what kind of safeguards are we going to have that this information that is gathered through the use of the license plates, that it will stay within criminal justice agencies, and that the agencies that it may be shared with will have the proper policies and procedures. I guess what concerns me, right now, criminal justice agencies in Michigan use LEAN and NCIC. They have been in existence for decades. They are monitored, regulated, administered by the Michigan State Police and the FBI. I don't know who flock safety is. Do we have any control over how they handle their business, how they handle their data? To me, I'm concerned about it under the Fourth Amendment with unreasonable searchers. Where are these cameras going to be? What if I don't want my license plate monitored as to what intersections I go through? What rights do I have for that? I'm not a known criminal as yet. Let's hope it stays that way. And the majority of the people in this county are decent, law-abiding people. I don't understand why this is a program that we should have. I just want to know who's going to monitor, audit, regulate the data that is going to be collected. I think we need to do further research before we do a trial run.
All right, thank you, Kathy. Motion to adjourn, so.
3 minutes go fast?
Thank you.
All right, any other members of the public that wish to give public comment? All right. Not, move on to commissioner comments.
Take a break.
No, you'd like to.
That's a comment.
Do you have any commissioner comments before we do that? All right, we'll do a quick 5-minute break before we get our action items.
Thank you.
You want to do
That's a
first?
hopeful-
You're not
You gotta
bad.
find a taker on that one.
That's a hopeful one.
We're live.
Is that better, you think?
Yeah, I can't hear any buzzing right now. Yeah, I can hear it a couple times, but it's really annoying, so.
Okay, tell me, can you hear it now?
Yeah, definitely.
Really?
Should just turn it off.
Okay.
This is a long thing. Wow. It's good to know.
Yeah, she gets fired up.
Oh.
Yeah.
All right, you going good then?
Yep.
All right, we'll get started with our action item number 1, which you got Sheriff's Office block safety. Let them go through that and brief us.
Good morning. So I'll give you a brief on it and I'll have Under Sheriff Kiesel give you some technical information on it. The flock safety system is set up as a camera system that basically is at set point locations where you set it. We've come up with 12 places we'd like to place it in the county. There's a 60-day trial period with the company. What Flock does, they install the cameras, they do the licensing with the state, with utility companies, whatever, to put cameras up. Basically, you're on cameras all the time, every day, on people's Ring doorbells, on businesses, supermarkets, athletic places. There's a lot of cameras out there. What Flock does is it focuses on vehicles driving and people registered to driving or could be a hostage in a vehicle. Flock basically is used in Grand Traverse County very successfully. If a child molester from Texas comes into Michigan, that camera picks up that registered owner, that plate, and sends a notification to the law enforcement agencies, state police, Grand Traverse County, us, DNR, saying a child molester driving this car, a sexual predator in this car, a person who committed a rape here, a person who committed a homicide there. It basically picks up and flags those vehicles by type and description of vehicle, by license plate registration number, and direction of travel. So we picked 12 locations in this county for a test period to run it by you folks. Ideally, what happens is the county adopts it and each township then pays for their own. If Glen Arbor Township doesn't want a flock camera, so be it. I don't see it as a county obligation. That it's an ask to do the test period in the whole county, lets everybody get a look at the system, lets them understand what Flock is about. It is not used for traffic enforcement. It is not used to spy on who's having an affair with who. It is simply to point out people with logistics involving warrants for their arrest, stolen cars, criminals in the community, after crime criminals trying to leave the community. It gives us a look at who they are and so forth. So I will let you ask questions. I know you're gonna have a lot of questions on this. I'm a small government guy. I do not believe in Big Brother spying on people. I do not like the concept of automatic traffic monitoring systems and red light systems. I understand in some areas are necessary. Hopefully they won't be here, but this has to do with catching hardcore criminals or people wanted for arrest with arrest warrants. So.
I'm sure if you want to speak to it.
I'll wait for the questions and then probably, yeah.
A motion so we can do that properly.
I move to recommend the County Board of Commissioners allow the Sheriff's Office to enter into an agreement with Flock Safety to conduct camera traffic study in 2020.
Sorry. All right, moved and supported. Discussion. Commissioner Wessel.
Appreciate your comment, and I think this board has been supportive of your department throughout. This really scares me. And before we take action, I hope our administrator will send out this ACLU article breaks on your police department's use of Fox mass surveillance.
And the concerns I have when I went through my research is it's a private firm. The data they collect in Leelanau County can be sold, can be distributed, can be used for whatever purpose anybody else using flock cameras wants it for. And I watched what happened in LA just yesterday. I don't want to support something that's going to be misused, not by us, but by who knows who. And I think we gotta be really careful. Yeah, we want to catch stolen cars, but we do not want to frighten our residents. And so I'm going to ask you to send this out to people. I know it's ACLU and it's obviously a liberal discussion of the class program, but there's other resources and there are other communities. And if we do it, we at least have to figure out a way to protect the overreach. And I don't know that I like the private nature of the flock business, because I know what they do. They sell data to other people. So that's my concern.
I guess I would comment on that with, I agree with you. I do not want to see people utilizing that, and that is going to be up to whoever your sheriff or state police colonel or commander is, to ensure that it's used in that defensive posture, that if there's a crime, we can immediately or very closely solve the crime, or that we can prevent crime. We're not really talking about one specific type of crime. We're talking about known child molesters that come into your community. They shuffle around, they use, there's a variety of different things. They move locations. I'm with you 100%. I'd like to see an article as well. And I don't have a problem with it being ACLU or from either side of the fence. And I don't have a problem with discussing it. We're bringing this to you to think about, to look at. The system we know from looking at Grand Traverse County, and I've talked extensively with the sheriff and undersheriff, they really push it hard down there because they've had such success with it. But I, like you, don't like the idea of somebody holding data that could be sold or could be misused. I see it as an objective law enforcement tool, but I have the same concerns.
And I'll say too, I mean, I can only speak to the information we've been provided. They flat out say they do not sell. It's in the literature. It was in your packet. They do not sell to third parties, and all of the information is only kept for 30 days. And more or less, yes, it's our information. Yes, they store it. Other agencies, if they're tied into the system and need, then they can get to it, but it's not available for public consumption or third-party sales based on their pitch.
It is my understanding that they provide our data with any other flock subscribers.
To other subscribing, yes.
And it's not just public agencies that have the flock system, it's private businesses, and it's anybody can purchase it. It's not just for government. So that's my concern.
That would be, I'm with you on that. It's not the business of General Motors who's driving what car and what road for marketing purposes. I look at it only in a law enforcement context, and I don't like to see things abused. So I understand totally what you're saying.
Mr. Algar?
I would be very concerned. I think that it could be misused. If right now we have hardworking citizens who've lived here for years and years and years, who have not been successful in navigating our citizenship programs, which are difficult. And this could be turned against any one of us. And I don't think we live in a county rife with these kind of problems. I don't think we need to increase our surveillance of our people.
Well, I think one thing that needs to be understood, because I think there is a misnomer with license plates. Even if it's your license plate, Madam Commissioner, we only find that plate and know where you went if we put that plate in. Somebody has to manually enter that we're looking for something specific. for us to get the information out of the system. It's not automatically running your plate and doing that. It's simply storing it that if we need it, either in real time or over the last 30 days, then we can enter your plate and it'll say, yes, you were here at this time. Yes, you went through this intersection, this intersection, this intersection. It's not automatically flagging. It's not automatically running. To answer the public comment question, it is CJIS compliant. It's tied in all 50 states. There are several thousand agencies, private companies, like schools use them, other places. You can't just buy a subscription to get this service. You have to be part of it. To be part of it, you have to own cameras. I mean, so it's not just like open and readily available for anybody to pay a monthly fee and just have access to all this information. And even if you do, and you put in a plate that happens to be your plate, that plate doesn't say who you are. That information is then run by us through the lien system to determine. It can't determine that your plate is registered to you or my plate is registered to me. It simply says this plate went through this intersection at this time.
So there's a lien law enforcement information network, and there's an NCIC National Crime Information Center where we can access information. For instance, Commissioner Campbell is a deputy. He sees a pretty girl, wants to run the plate, who's a pretty girl.
But she's my wife, right?
Yeah.
Okay.
Wants to know where she is. He runs that plate. There's a reason he has to run that through lien NCIC. There's a reason he has to have to run it. There's a record of it, right down to time, date, and hundredth of a second. And there is a penalty if it's found out that it is not traffic stop. It was just a pure interest in someone driving by. That would be a lien violation of which you would be suspended or terminated and prosecuted for, or prosecuted for his decision of the prosecutor. But basically there's safeguards in place to make sure that system isn't abused. So you're not running to see, who's driving this type of vehicle, who drives electric vehicles or girls or something like that. So there's safeguards in place, which I would like to see for Flock as well, to address your concerns, who has access to the information and to what extent can it be distributed? Because personal rights and small government are both very important to me. One, that you're not spied upon unnecessarily, and two, don't grow government too big. We don't need to know what everybody's doing all the time. This is a free society. We have to stay that way. What I've seen of Flock, I've never seen it abused. And I would want to monitor that. And I would want us to look at through this time period, is a 60-day trial period where they install the cameras. They're so confident that you'll like it that they say, we'll do this all free up front. Take a look. And at the end of 60 days, you can look at it and say, well, there were 17 child molesters moved into the county and there were 52 warrants for felony violations of armed robbery, rape, murder, whatever, picked up because of Flock. We found out who they were. It keeps your community safe. And this is why I think it's important the county not burden the whole. It's $3,000 a year per camera. We picked up 12 locations. So it's $36,000 a year if you decide you want to fund it as a county board. I look at it as, if I lived in Glen Arbor or I lived in Northport, I would want that camera because it does nothing. It's like air. It's just there until there's a problem. And when there's a problem, we can go to it and say, who drove through this intersection between 1 and 3 in the morning when this armed robbery occurred or this person broke into this home? It is that tool we use. And again, I think the safeguards are important, but I want to make sure you understand that lien and NCIC are very well guarded, that you can't just use them willy-nilly. And that's what I would look for in Flock.
Commissioner Walter.
I use this system where I work. So, a couple examples, we had a recycling bin on our premises, pad note. So everybody knows it's steel, sitting out in our parking lot. So then we had a truck pull up and start throwing stuff in the back of his truck because he was stealing it, go sell it for recycling. Okay. So get a call and say somebody's out in our parking lot. So then we get on the cameras, we look for this vehicle, because we know what the vehicle looks like. It picks up the camera, it picks it up on the camera when it leaves. And so we got a picture of the plate, so we call the sheriff's department, we give it to the sheriff's department, and they deal with it. That's what the system's for. We have an employee who's threatened his supervisor and he's been fired. And we asked him to leave the presence of the facility and, take a picture of his car when he leaves. So that if he drives back on the facility, we can put that in the system that it alerts the system if somebody like that comes back on the facility. So he's threatened the life of the supervisor who's fired him. I can tell when that guy comes back, or if that guy comes back, or if girl comes back. So that, it's a safety measure for us. This vehicle just showed up on your facility. I get a call on my phone that says this vehicle's just entered your facility, so I can go up and respond and see what's going on, or call law enforcement. That's what the system's used for. It doesn't tell me who's driving the car, it just tells me that car. Granted, we put that information in there that, to alert us to that license plate. But if you were in a custody dispute and your spouse grabbed your children, left with your children, we can put that information in the system and it'll pick it up wherever that car goes to alert law enforcement where that child might be. It's a safety system. It's not an enforcement system, and it's not drawing information of the driver. It's just a license plate. I can't give any information out. It doesn't have the store the information of whose car it is. It's just a license plate. We can track this. It's like having a air tag on your phone. It's not much difference. Hey, I'm looking for my phone. Where's it at? What law enforcement acts is they have to have a reason why they're looking for it. I have to type in a reason why I'm looking for a plate. If I'm looking for a plate, we don't use it for that. We don't look for a place. We use it just for the safety of the residents of the facility I work at. So I'm not as opposed to the system. It's not as far-reaching as you think it is. It's specific place for specific reasons. It's just not a random thing.
Funny.
Yeah, I know that, I've read in magazines that Leelanau County is one of the safest counties in the nation. We also have the highest ratio of law enforcement officers to residents with the national park officers, with the tribes, with the, conservation officers, with our deputies, with the state police. I mean, our ratio here is higher than anywhere else that I've ever heard of. Also, I know that pretty much every person I know has a camera on. I mean, so we're oversaturated already. And as you said earlier, there's doorbells, there's all kinds of things. I mean, that has cameras. Because I know I've talked to people in Carver City standing at their front door. It's there. And so it's opening up a whole nother system of spying on the residents. And I just don't think that we need it. With being the safest county, do all the things that I've known. We don't need to add another layer of looking at residents as what they do. So I just don't, I just can't support this at all. I mean, and plus what the other commissioners have said, I know it can have some good uses, but I think the negatives far outweigh the good uses.
Thank you, Mr. Borkovich, Mr. Kiesofer. I just have one question, and that is, who owns the information? Does Leelanau County own the information?
The flock system is, go ahead.
Per them, it's our information. They are the holder, but it's our information. And then
So-
it only stays for 30 days.
I'm not trying to be disagreeable, but I just believe that indeed they own the information if they're the ones distributing it. They don't ask us for permission to distribute. I mean, that's my, I know you can, you know, that they have a way of explaining the distribution of it, but as far as ownership, I'd be interested in that answer as far as the actual.
It's on their
ownership.
computers, in their cloud. There's no question in my mind, they own the information gathering system, so they have access to it. My concern, same as yours, is I don't want it abused or misused. That's why you need these check and balances like Lean and NCIC, how structured that is and who has access to it. You know, and here's something to think about too. This is new to you. I've been thinking about this for a couple of years because I keep hearing about all the goods happening down in Grand Traverse and from other places where this is a very effective system. This is new, and I'm not one to like just throw some at any expected decision. Research this, look at Grand Traverse. I could have the Grand Traverse Sheriff here. I could have state police here. Roger Craig is saying here from the Lieutenant for State Police. The undersheriff or the sheriff of Grand Traverse County could come and give you actual examples of how, where, what, why they've used it, and how they then, once they got it out in the community, got the support of all the townships saying, we want that right here, right now. And that's why the townships are paying for everything at the local level where they have local control. And again, if Centerville Township doesn't need one, or Omina doesn't need one, so be it. That's their decision at the township level, if you will, power to the lowest level of the people, which is good. So I don't think that it's clear in a lot of people's minds, hearing all of you talk, that access to the information is totally protected, and I think that's important. I do think that it's a good tool for law enforcement. There's a lot of tools out there, but I do think that to absolutely shun yourself from the system till we know more, maybe this, if you're not supportive of it, maybe this could be tabled for a future meeting, giving you more time to research, more time to look into it. We could have the other officials, other sheriffs come here, or Flock would come in, put a presentation on as well. I'm not trying to sell you something you don't want. That's not me. It's not why we're here. I just know that I want to keep Leelanau. That's why I ran for sheriff. Is Leelanau is a great place to live, work, and play. People move here because it's safe. They move here because it's beautiful, and they move here because they feel secure, and they're not feeling secure in a lot of the cities. They're not feeling secure in a lot of states in this, in you know, areas of states of this country. And this is a place people are gravitating towards, but don't think we're above crime, drugs, bad things, because we're not. So I would just throw that out to you, that let's maybe think about it before we definitely said no.
Commissioner Robbins?
I've listened to everybody. I'm gonna take a different approach here. First of all, for me personally, I wish you would have brought in how many townships would sign up before we start this, you know. But a lot of townships may not want. Everyone's gonna hopefully be footing the bill here. I look at $36,000. I'd rather put that towards another deputy. Or overtime, for overtime grants. If we're that unsafe as a community, I don't think this camera's gonna be, you know, it's a tool. First of all, let's go back, who's the chief law enforcement person in our county? It's Mr. Hubble. Has anybody talked to him whether he would like that tool? I mean, let's start with him. I mean, let's get our ducks in line here. I have talked to Grand Traverse. I talked to Shay, and I talked to Felix quite a bit. They're in a different community than we are. They got 700,000 people, 365 days a week going through that community. We're on a peninsula. I don't think we need 12 of them out here if we were to go that route. Now I look at over the weekend when I saw this coming out, this is your Bible here you put out every year. I look at our stats. Our stats doesn't, we can't predict the future, what crime's gonna be here, but right now with what this is, I don't see where it's a tool that's gonna benefit our county right now. Maybe down the road. We got a jail, 3 to 6 inmates. I mean, I would like to saw your detective and give stories on other counties where maybe this has worked. But like I went talk to Grand Traverse, yeah, it flags a plate, but you still gotta get your patrol car, you gotta go fight it, you still gotta do police work 101. It just tells you that the person was in your area. Doesn't mean that they're still in the area, it just means they traveled through. So I think, before we rush into anything here, my field, what I used to be in, I used to be a detective sergeant. I just don't see a need for this out here right now. I mean, I will back you on anything, Sheriff, but I don't think we're at the point where we need this now.
All right. There, Commissioner spoke. I did get a chance to review this. I looked over it last night and I certainly had some concerns. And I guess my main question was, do you know how many counties around us already have it? I know you mentioned Grand Traverse, but Benzie,
Antrim does, I know for sure.
Antrim does.
Other than that, Benzie does not know. Grand Traverse and Antrim.
You know what, for a future board meeting, we'll get you how many counties in Michigan, how many counties in Northwest Michigan. We'll even make a color map. We'll do a regional, we'll do a state, and if you want, we'll get Flock to give us a national. And I don't have a problem waiting. I share a lot of your same thoughts. I do not want people spied upon. This is a free society, a free country. I just know it's a really good tool. And that we don't make a decision on that today is okay with me. We're presenting this to you because that's the process. In some areas, they may just do it without asking. I wouldn't do that. They may just say, we're gonna buy one or two and it's less than this much money, go and try it. I'm not gonna do that. I'll be upfront with you. And if there's concerns, let's share our concerns. Let's research it. Let's look into it and see the value of it.
Well, and that's kind of because just reviewing it last night, like I certainly had some concerns in it. I mean, Flock, I'd never heard of them until I read this. So it's like, I'd certainly like to look into it a little bit more. And it does concern me because it looks like they own the devices, and if they own the devices, they own the data too. So I just think I feel more comfortable we postpone it and just look into it a little bit more forward. So Commissioner Allgaier, and then we'll have a vote.
And I have concerns about spending 36,000, another 36,000 a year that will be built into our budget for eternity, and it'll go up. And I don't think we need it.
Commissioner Ross?
I have a Robert's Rules of Order question. If we have a motion, but I've heard lots of concern, rather than take a vote on that motion, could we withdraw? Would we be willing to withdraw the motion and further study at a later date?
I would withdraw the motion and entertain tabling it for further date.
Would you like it to come back for a specific meeting? August meeting?
Personally, I'd wait a little longer because what I hear here is a lot of good ideas and thoughts, a lot of good hearts. Let's take time for our minds. Let's look at it, research it, look at other reviews and give us time to get with Flock. I personally like to see it go a little longer. I mean, we were talking about next March or so, trying the 60-day thing. Put it in next year's budget. If we don't need it, we don't need it. But if we put it in there, we tried it, and after 60 days, it doesn't come up with anything, or we don't like it, we're not obligated to it. So I think we have some playtime here. This is a July meeting, and I've just soon maybe September, October, get some time to look at it, think about it. And if it's valuable, fine. If it isn't valuable, I'm not here to sell you something you don't need.
All right, is the second okay with withdrawing as well? I'm assuming it's
Yeah,
original.
second.
Okay.
One question for the sheriff. I guess what I'd like to see is, you mentioned a point, put it in our budget. Let's just say, I don't mind the 60 days if the townships want to pick it up. So put it onto them, keep it out of our budget if they, we can initiate it for 60 days and then find out what townships want it and their villages, and we can discuss that at a later date.
That's kind of our plan, looking at Grand Traverse and talking with Sheriff Shea and Under Sheriff Fulis. And I said, how do you fund that? And they said, well, we did it as a county, and then the townships each wanted their own. So some of the townships have more than one camera. So it's paid for at the most local level, which is good. If you want it, fine. If you don't, fine. I mean, it doesn't matter to me. It's a tool. It's something we found out about. I've been aware of it for a couple of years because of the effects they've had. At the Michigan Sheriff Association show, I met with the representatives of the company. We've since gotten in touch with them. We've laid out maps, direction of cameras, and so on and so forth, pretty much including all the main, like in Leland, in Northport, in Empire, in Glen Arbor, places like that, down in Elmwood. And we laid it out for a cursory view. And that's all this is right now, is a cursory view of what that system can do, what it's capable of or not capable of. So I have no problem with postponing it. Whenever you want us to bring more info, we will.
All right, Commissioner Bunnick had a comment.
Yeah, I just have another concern about the responsibility of them. I mean, from what I read, that they own them, but if one is stolen, damaged, you know, or anything happens, we have to pay for putting it back up and for buying a new one. And that kind of concerned me. That, you know, from what I read.
Not to my knowledge, but I'm not willing to go out.
Print like right at the
Well,
bottom.
that's one thing we need to research, because I don't think that's right, that we should have to, it's their system, they contract with utility pole people, and it's their camera, all we do is lease into, if you will, the information together, and I agree with you, that if one is damaged in a car accident, why should we pay another $3,000 for it? So that's the fine print stuff we need to look at.
Right, well, and the other thing that they talked about is that the hardware and stuff is not included in their, you know, in them putting them up. I think it sounded like, and I don't know if this is true, that all the hardware and anything that they needed to put up, we had to pay for as well.
Did you hear that?
For the initial,
And I don't know whether it's initial or whatever.
so the initial and all the equipment installation is, they handle all the permitting, all the costs. I mean, that's why you come to you now, it wouldn't happen until next spring, because they figure depending on the locations, if it's MDOT, if it's consumers, if it's Cherryland, if it's township, they figure anywhere between 6 to 10 months for permitting and everything else.
These are all questions we'll have answers for you on in the future meeting. We'll get you answers. How many townships, what the hidden costs are, if there are any, the way it was presented us. We put the cameras up, you buy into our data, you have data and you share with everybody else, which is good, because criminals are criminal, doesn't matter if they're in Florida or here. So we'll look into all those questions and get answers for
And
you.
we've even talked about if they're stolen, we have to buy them.
Yeah.
On to Commissioner Bunnick's point, I did read that in their packet as well. I wasn't sure if it referred to, because in essence, they were putting us on as a trial run. So I didn't know if that was the packet, were they sending us a packet as a client or as a trial run type of thing? So I didn't know, maybe the two didn't intertwine, you know, but I read that as well. I was curious about that, but just something to check in, I guess.
We'll learn more about that based on your questions and our questions, what we have, and when you want us to represent, we will.
Thank you.
All right, thank you very much.
Thank you for the opportunity.
All right, so next up, we have item number 2, Prosecutor's Office, MDHS CDR grant renewal. Got the prosecutor here.
Morning. I have a hopefully an uncontroversial topic. And so this is our Victims' Rights Services contract. Most of our budget most of my budget for Victims' Rights Services come from the state, to support the cost. It's a constitution. We are constitutionally required to maintain this office and provide services to the victims. So I would ask the board to recommend approval of this contract, and which would commence on October 1st of 2025 and run through September 30th of 2026.
And I move to recommend that the county board of commissioners approve the county prosecutor to renew the crime victim rights grant with the state of Michigan. And the amount of $40,397 for a period of October 1st, 2025 through September 30th, 2026.
Second.
Supported by Commissioner Robbins, discussion.
It seems like I saw now page 45, there might be just a little typo in there. Let me get the last sentence in page 45.
Oh, we need to read that.
Yes, yeah. Anyways, just there's a little typo. We just straighten that up. Should read social services and works with senior citizens.
Senior services.
Yeah. So anyways, so the salaries for.
It also should be prevent scams, not revent.
That's the one I was thinking, prevents, not reinvents. Just little stuff, anyways, I don't know if anyone else see it. It's a lot easier to see it when I'm not an editor, I've noticed. So, so the grants for 40,000, says victims' rights prosecutor in the budget summary. That's really what you call a victims' rights advocate.
Correct.
Same thing?
Yeah, it's for Lori Lacrosse.
Yeah, that's right.
And so she'll be submitting her budget this year, and that'll be reflective of the amount of the grant, and that's where the funding comes. Thank you.
Joe, it's on page 7 of the 16.
Sorry?
It's on page 7 of the 16.
Okay, there's a correction that needs to be
That
made.
needs to be prevent instead of prevent.
Page 7, 16.
Any-
Okay,
Any other discussion? If not, all in favor of that motion, say aye. Opposed, say nay. Motion carried 7-0.
thank you.
Thank
And,
you.
and we'll make the correction.
All right, thank you.
Thank you.
All right, next up, we have finance audit presentation.
Page 58 in your packet, there's an EDS just outlining the fact that the 24 audit of financial statements of governmental activities, business type activities, aggregate discretely presented component units, each major fund and aggregate remaining fund information of Leelanau County is complete and the reports have been issued. You can find them online with the state of Michigan. I did send a link to all of you if you'd like to see it. And Administrator Dyer has hard copies. I'm hopeful you've all picked up your hard copies by now so that you are ready for Steve Peacock's presentation next week. He also has been asked to be placed at the latest part of the agenda so that we can take time. You can listen to him as he presents the audit to you and ask questions.
Chair Allgaier.
I move to recommend that the 2024 audit presentation by Steve Peacock, principal of Lehman and Board of Commissioners discussion of same be moved to the regular meeting Tuesday, July 15th, 2025 agenda.
Supported by Commissioner Wessel. Discussion? Not, all in favor of that motion, say aye. All opposed, say nay. Carried 7-0. Marijuana operations.
Yes, and we applied for the MOOG, the Marijuana Operation and Oversight Grant, in the latter part of 2024. And the contract terms with Benzie Leelanau to administrate that grant were determined after the grant application. So rather than use, we decided it would be better if we utilize the vendors already an established relationship with Benzie Leelanau. And in order to submit my grant report due July 15th-ish, I need to have the budget amended because we're paying Benzie Leelanau the full amount of the MOOG grant, and they are utilizing their vendors for the stash boxes and the billboard advertising and paper advertising.
Commissioner Wessel.
I move to recommend that the Leelanau County Board of Commissioners approve the amendment to the 2025 marijuana operation oversight grant fiscal year 2025 budget for the terms of the MOOG agreement as presented and authorize the chair to sign the budget amendment.
Second.
Commissioner Robbins, discussion?
I would just like to say that the little stash things are, if you have any concerns about that in your own home, they're very effective. And they're available at the legal office.
The health department, yes. And Dan Thrall has told me that they are being picked up. People are going and getting these boxes.
Commissioner Campbell.
Well, my question would just, as a sizable amount of money, has anyone contacted the health department to see if they have ideas for other uses of it? I mean, it seems like we're throwing, the original budget was for X, and because we got more money, we just X times 1.25. Is there, are we best utilizing this extra money is my question. I don't know the answer.
I think I can respond to that. The health department did come to us and ask for this. And they had a plan for promoting it and using it. And that was a direct request from Dan, the chief medical official, and Michelle and the health board.
They came to us last year?
Yes.
Yes.
What's the point?
But this money is available every year.
I know, it just, as I said, we're just putting a multiplier on it and throwing more money at it, and I would like to know if more money is needed for this program, or program with that much more money. Each one, I mean, so, anyways, that's my concern.
Mr. Blaine?
Yeah, because I was thinking that that money could be used here at the county for, you know, whether the sheriff needs it or the, you know, if someone has a, you know, an overdose, they have the pens or whatever they are with them. I mean, and that could be something that could be used actually we could purchase for that through that money, you know, or whether it's just EpiPens or whatever, because they're all health things. I don't know if that really qualifies, but I do think that we need to look at what we could use it for here as opposed to just being a pass-through for it.
Commissioner Algar?
You know what, next week I'll present some information on how to use exactly. You know, so we can make an intelligent decision.
Could we ask the health department to provide us the information rather than going through what, I mean.
That's what
I might be able to answer some questions now, if you have some specific questions.
Oh,
Out
yeah.
of line, I'm sitting right here, so.
Come on up, Michelle.
Yeah.
And this budget amendment is a line item, it's a net. There's no additional money. We're just amending,
Right.
and it's a net budget amendment, so. Go ahead.
Yeah, so when we started this, we did this in Benzie last year. It was very successful, a secure your stash campaign. Specific, the marijuana funds, it's not a lot of money. So, you know, what can we do with that that has an impact? It's specific to marijuana. And so it was successful, and we know this money has, you know, kind of sat here unused. So we just approached the county and said, hey, we have this idea. What do you think? And initially, when we set this up, as Kathy said, you know, we have an option of we pay a little, you would to give us a little money for some staff time, but you guys would purchase the lock boxes and the promotional materials. But rather than going that route, it was easier for us as a health department just to do all of the work. So that's really where this change is coming from, with my understanding from the initial, from where the way it was initially budgeted is we're just doing all of the pieces of this particular funding. So, and it is, we have locked bags and boxes so people can lock up their marijuana products, or quite frankly, prescription medications, vape pens, other things that you don't want young people to get their hands on. And then we're doing a campaign, you know, a promotional community campaign, just again, encouraging people to be aware and lock up their products.
Oh, good. I
So-
was not gonna say that. You've got a prescription for painkillers. I was cautioned, but.
Yeah, well, it's
If you
not,
don't want grandchildren getting into it.
Yeah.
These things are great.
they are, right. They're multi-purpose.
My question is if you had a place already for this, if you needed more of these lock boxes, things like that. And your answer is yes, I believe.
Well, right now, we still have plenty. We're still distributing them. So we don't need additional money for more than what was initially planned for right now. Is that what you're asking?
When I'm asking where the money will go, what program?
So the money,
Yeah.
so the money that we're using is going towards, we have one staff person who's doing the work, right? Who's working with the campaign folks, making the purchases, getting out in the community. And then we have the purchase of, I don't have the details, right? The purchase of the lock boxes themselves or the bags. And I think there are some cards we made up with just reminders of, you know, how to lock things up and when they should be locked up. So there's, yeah, there we go. Yeah, so there's, the 4 line items. It's a really simple, I mean, it's what, $13,000. So yeah, so we have advertising, we have supplies, and then we have the contractual line, which is really the staff time to do the work. So we are well within, you know, we're very cognizant of the budget and staying within the budget and the line items on that budget as far as the work that we're doing. Does that answer your question? I feel like there's still, yeah. What?
Well, I wondered, all right, we're gonna put 13,000 more into it, and that was my question, right? And do I
No.
not, am I not?
No, this
I
is
thought that's what that
this is the
says.
original grant.
Right.
And it was originally submitted with 3 line items for advertising supplies and contractual. And we drafted a contract with Leelanau to a total of the grant, 13,000, so that they use their vendor to pay. We're not using our vendors to pay for the black boxes. We're not using our connections for printing and publishing. They're using their connections. So we write a check to them for 13,000, which is the grant. They're spending it all. And I report that we spent our grant of 13,154. It's a line item adjustment.
I interpreted it as increasing that program from 60 to 73, so that's my mistake.
Okay, yeah.
Incorrect on that.
Sure. And this is an annual grant that has been brought to our attention by Leelanau Health Department. So this will revisit in the fall when the next grant round comes about.
That's what my
Yeah.
question is.
And in the past, hasn't some of this money gone for programs? So once you've distributed all these stash bags, how many stash bags is the county need? So we could perhaps expand and look at other things. I know when I was on the SUD board, I believe, I don't think we had the marijuana money then, but there is a dearth of funding for
We have the
programs.
opioid funding, yeah, that you have, yeah. Yeah, this is more specific and, yeah. And we are happy to work with the county again next year. If there's something we can do, we can talk about that. Okay, any other questions for me? Just, I shall get that all back to my seat.
Yeah, no, it looks like it's just a simple amendment, so it's very, yeah, we're not increasing anything here, so. All right, all those in favor of that motion say aye.
Aye.
All opposed say nay. Motion carried 7-0. All right, next up, we are to HR. First, service credit purchase.
Morning. So we had a MERS service credit purchase last month on the agenda, and this is a new employee coming with a similar request. It's for the general service credit purchase, and all the cost goes directly to the employee. It's similar. Any questions?
No motion? Money?
I recommend that the Leelanau County Board of Commissioners approve by resolution that Johanna L. Novak be authorized to purchase 5 years of general service credit from MERS as described in the application for additional service credit purchase at a cost of approximately $49,347 to be paid by the employee.
Second.
Moved by Commissioner Robbins, discussion.
Just a quick one. Should we have a policy on this? They always kind of come to us. We've always said yes, so we've set a precedent without a policy. I mean, would it be beneficial if we had, on your behalf, when you're explaining to employees what their options are, we had something actually in writing rather than what you, I think the board will approve it because they always have.
So there's 2 ways you can go. You could have a blanket statement, a resolution that says, yes, the county approves all service credit purchases. My understanding was that you guys would want to know when this is happening. So that's why each one is brought to you individually. So do we need a policy? I don't think so. We have a standard practice here. Does anybody
I would
feel strongly?
concur. I don't think a policy is in order. These are all, even though you approve them all, they all have very potentially different scenarios. Like this one, for example, it doesn't result in an increase or a change of the person's retirement age. Sometimes it does. So it's hard to say that one is always the same as the next. And I think you ought to consider them individually. It is, the good news is MERS has what I would consider very conservative actuarial assumptions, and more importantly, return on investments that makes it less likely that granting one of these will result in actual costs to you in the future. And this one would not, because it doesn't change the retirement age at all. It's simply all she's really doing in this context is saying, I'm taking some extra money and putting it into the MERS funds to increase the final benefit at my ultimate retirement age. So this one would be, you could have a policy for this to always grant these kind of requests, because it wouldn't create any kind of potential for an increase in costs to you.
I might go the opposite way and say, my assumption has always been that they're virtually the same. And if we're approving some that are the same and some that aren't, that I'm not smart enough to know that difference and know what benefits the county and what doesn't. So if we had a policy to guide us, we wouldn't be making these on an individual basis. We'd be making them all for the long-term benefit of the county with an understanding of, by the employee, of what's coming.
If we were to prepare a policy, it would be something along the lines that would guide you in a decision-making. It would not be a policy that would say, in this instance, you would grant it, in this instance, you would not. I would, if you would like something like that, that would give you a guide as to what it is you're actually considering. We try to conclude that in the EES, but we can do that as kind of an educational piece, if you're interested in that.
I'm not interested.
Sure, Wessel?
I'm not interested.
I do think we need to know that there are some of these that we might approve that are possibly quite costly for the county.
I would say it's unlikely to be quite costly, but, and the problem is with these kind of service credits is you can't predict whether they will be or not, because it'll depend on future events that you have no control over. That's the problem. That's why I say it's a good thing that when MERS prepares one of these, anytime we get a request for this, we have to submit a request to MERS, and they evaluate it from their actuarial rules and their expected returns on investment. And the potential negative is it could reduce the amount of your percentage funding based upon the benefit that the employee will get. But you won't know that necessarily for a couple of years. And the better thing for you, I do actually mention it in my report to you, is you've shown consistently between 79 and 89% funded for the last 15 years on your MERS program. That's the evaluation criteria that you need to look at as to whether you're in good standing with respect to the funding of your retirement programs, not a specific individual request for benefit changes, because that will not impact that percentage to any great extent, if that makes any sense.
Your money?
Yeah, I was just wondering, does she pay this all at one time, or is it on some kind of installments?
The employee is required to pay the lump sum to MERS. Yes, there is a deadline for them.
Yeah.
Thank you, Jen.
Does it say the date?
Yeah.
What I'll do is I will prepare an education piece that not so much a binding policy, but here's how these things work, so you can better evaluate them as they come up.
All right, any other discussion? All right, not all in favor of the motion, say aye.
Aye.
All opposed, say nay. Motion carried 7-0. All right, next up, we got job description updates.
Okay, so the probate register has been a salary position for several years, so it needed to be updated to that exempt rather than non-exempt, which is hourly. The account clerk role is no longer under any of the elected officials. It's only in departments. So we reflected that change. The secretary and the equalization technician position needed the physical requirements, and that should be on all the job descriptions. So anything that I'm going to bring forward to you is going to have that language, and that came directly from legal counsel. on what is required for that role. If we talk about anything that's out of the norm for office work, then the job description physical requirement portion will come again from legal, but the same one I'm using for each of these updates. And that's if anyone has an ADA, like they might need some assistance after surgery or something, you know, how do we accommodate that request? And so that has to be in the job description. It really helps guide HR to provide those services the best that we can.
I move to recommend that the County Board of Commissioners update the job descriptions as presented.
Second.
Supported by Commissioner Robbins, discussion.
Thank you for that work.
If not, all in favor, say aye.
Aye.
All opposed, say nay. Motion carried 7-0.
I have a question. Has the lactation fund come? It's semi-related to her.
Yeah, it is here and it's pending installation.
Okay.
We've selected an area that is just in the hallway between that connects the elevator lobby and the main portion of the garden level floor. We need to put some photographs and that sort of thing, but it's going to be in the hallway there. We verified through the building safety department that that location will not violate the building codes or anything like that.
I saw one the other day.
All right, moving on to our agenda, building safety legal take-home policy. I guess the main thing there is just to move it forward to our next meeting, next Tuesday. Funny.
Yeah, the other thing is about the purchase of the vehicle. We did discuss that and approved that. I would think that that should be included with this.
I can speak to that. I think that your direction, because I didn't get those minutes done just yet, was recommendation for her to purchase, but I think at the table, she said she was gonna check with Lauren about going through my deal versus looking at the Sierra and Traverse. So I think when she comes back with a price to approve and which vendor, then she could go on the agenda as soon as possible. But I think she has to have that. I don't know if she'll have that by
Right.
Tuesday night.
But I just thought we would move it forward as well in case she does have it.
So I don't know if you just want to add it as a late addition to the regular session, if she can get it together.
I think that'd be preferable.
Because this
And,
is something
all
different.
right, in addition, you'll note in my report, one of the things we're reviewing, and a lot of it requires a significant input from the sheriff's department because they have the most number of vehicles, is whether we would potentially move to a managed fleet management contract with someone like Enterprise. We've been working with them quite closely on that possibility. We think there's a significant potential savings over the next 5 years to doing something like that, but we're not yet ready to jump into that. If we were, this purchase of this vehicle might be the means of starting that process.
So, I mean, do we want, I guess my question is, do we want to move this forward until the next week? Or do we just leave it off the agenda?
Do you think we'll have a policy, something in place to have discussion next Tuesday, or is that pushing it?
Just do it as a late agenda.
I would think that would be better to know whether we can actually get to that or not.
And I would suggest we skip 5 and 6.
Just consider that as being tabled.
Oh, perfect. All right, moving on to administration, item number 8, 2026 budget workshop meeting schedule.
Yes, I prepared for you a fairly lengthy budget process recommendation based upon discussions with most of you regarding the things that you would like to see in the budget process. The key elements are listed on page 95 in the memo that I prepared, that we would begin with an initial work session where you would have the opportunity to express to the staff your priorities for the upcoming fiscal year, strategies and things like that that you'd like to see implemented. Just a general discussion of the budget, and that would be the essence of our first work session. And the department heads could then, if anything affected their department that they would like to incorporate in their budget, could make some final changes before we presented to you a draft budget. The second portion would be a revenue and investment presentation from the treasurer. Again, that would be our second work session. Third work session would be what we would characterize as a kind of accounting or finance 101, where we have a discussion with the finance director about the internal processes that we use in the preparation of the budget, and potentially discuss whether any of those policies or processes need to change. The next set of work sessions would then be the development of a flexible and functional capital improvement budget. So you can actually consider projects that you may wish to approve in the coming fiscal year. And then finally, schedule department and elected official presentations to detail the actual budget that they're asking you to adopt. Any current, the presentation would emphasize what they currently do, why the costs presented are necessary, and then any additional funding or programmatic changes that they're requesting. As part of to have that kind of robust discussion that we're talking about, the treasurer, or excuse me, the finance director prepared a proposed schedule. What I'm suggesting we would do, if you were to adopt the process that I'm suggesting, we would work those into the proposed work session dates on page 97 and revise this schedule so we have a clear understanding of when each of these events are going to occur. The upshot of all that is, at our last meeting, we discussed the fact that traditionally you have focused on the annual meeting where you approve the apportionment report as the deadline for adopting your budget. That is always the second Tuesday, by statute, that's the second Tuesday of the month of October. Staff does not believe we can do all these work sessions that we're talking about and meet that deadline. We're suggesting backing that up 1 month to final approval of the budget at our meeting on November the 18th. That would give us, the statute requires that you approve the budget before your next fiscal year occurs. You can by statute approve a budget on December 31st of 2025 if you want to. We're suggesting, however, to approve that budget finally at the second meeting in November. If there's any reason why we can't do that, we'd still have a month of grace period to finish anything up that we might need to do in this first budget year that I'll be involved as your administrator. So we would propose that you approve the motion as suggested, adopt, and the last item again, I'm suggesting that you incorporate this budget process in your board rules that you adopt every year. You don't have that process memorialized anywhere. This would be an opportunity to have that as part of your rules. Obviously, you can amend those next year if you choose to do so, but at least they're documented somewhere other than in an item that you consider at the Board of Commissioners meeting. So that's the essence of the recommendation, and ask that you adopt the schedule and the proposed motion. And if you do so, we'll change again, the schedule that we presented to you last meeting.
All right, then we have a motion, so we can start with discussion. Commissioner Wessel.
I move to recommend that the Leelanau County Board of Commissioners adopt the 2026 budget schedule and process as presented in the July 8, 2025 County Administrator memo. Direct the administrator to revise the budget preparation schedule previously presented in June to reflect the process contained in that memo and to prepare a proposed revision to the board's rules of order and procedures to incorporate this budget process.
Second.
Support by Commissioner Robbins, discussion.
Just real quick, could I suggest that we just make this for 1 year? Just so we go through the process and review it next year before it's already put into place. I mean, 5 of us weren't here for the present budget. A lot of us are new. If you want to call it, a template, that's fine. But I'd like to, if you will, require a review of it before it goes into place for next year. Nothing against the process, but I'd like to go through it first before we say, this is what we're going to do eternally.
And I think you would do that as a natural course, because I do believe you approve your rules of procedure every year at your organizational meeting. So that you would do that at that time as well. If you didn't like the process, you just do it at that time as well.
I've said my piece. I would like to just go through it before we set it in stone.
Commissioner Money.
Yeah, I agree with what you're saying, and we can modify this anytime. This is just a preliminary, a guess at what dates we can make, but always we've been able to change it anytime we want it. We can say we can't make it that date, so we'll change it to the next day or whenever. So even though it could be, you think it's set in stone, it's not.
Comments? All right, I specifically like the way this is moving forward. I think it's wise to put it in our board rules. That way we have something to work off of. If we go through this process this year, something we didn't like, we'll know in our organizational meeting what we want to change in that. So I think it's a good template to at least put down so we don't forget the process and like lose it type of thing if we have it down. So I will support that as is. All right.
Can I ask, we talked about having a group session, if you will. I didn't see a date anywhere for that, or I missed that in the schedule where we talk about our budget priorities?
Yeah, that would be, we would more than likely be as the Tuesday, August 19th, first proposed work session.
It's on here, back there.
Yeah, what I hope that you would do is to adopt this process, and then we revise the schedule so all those dates are then established.
I say that because it's not on our list, our list of meetings.
It's on there.
Yeah, go to the bottom,
Page 97.
right there.
It's in yellow.
It just says work session dates, so
Right.
that would be the time when we.
Yes,
express
when we would incorporate items 1 through 5 in the budget process and indicate when those dates would occur. And I'm suggesting that they occur in the order presented in the budget process recommendation.
Okay.
So the first would be the initial work session with all of you presenting your ideas regarding the budget as an initial process, as the initial board involvement in the process.
I mean, I just saw the date, and I didn't see an assignment for what that was specifically for.
Right.
Believe it or not, I think it was a good idea to put the meetings connected to our meetings here, because getting the dates has been kind of a nightmare in the past.
Well, we have many things to take into consideration. That is,
And it's always on a Tuesday.
well, it's like try to consolidate your lives so that it's something workable. However, we also have to secure the room. We have to also secure a recording clerk for the process. And so there's a lot of moving parts. This does put a strain on our office, the administrator's office, because we're also preparing for some of these dates for this meeting or the evening meeting. So it's an ask, it's a big ask of a lot of players. And as Commissioner Bunnick mentioned, it can always be changed.
But we feel fairly strongly, particularly after my conversations with those of you that shared your ideas with me, that this kind of process will create a lot more involvement with the board in the development of the budget and a lot more potential for public input and knowledge about what you're actually doing with the budget. And a lot more time, frankly, for education of what it is that actually happens in this building, both for you as commissioners and for the public as well.
The only, but our public hearing for this, I believe, is not till October. And I would like to see a public hearing, maybe in that initial meeting of ours, so that before we get to that point, get to the finish line, we take the extra step of inviting the public. I know they can come to all the work sessions, but I've been to a few of the work sessions, and frankly, they're the reason coffee was invented. I would like to also have a public hearing, maybe on that August 19th, to invite the public to come in and give us their thoughts. And if they do, they do. And if they don't, they don't. Our job is to provide access. Can't force people to take advantage of it.
The statute requires that you have one public hearing. There's nothing that says you couldn't have more than one.
Thank you.
On the other hand, they're all public meetings with an opportunity for people.
And the public elected us to do this. Well, I mean, that's why we're here. We don't have to revisit every decision we make. They put us in this position to make these decisions. Because they trusted us. So we have to trust ourselves.
All right.
Oh,
That's all in favor of that motion, signify by saying aye.
Aye.
All opposed, say nay.
I would make a motion that we set a public hearing for August 19th and invite the public to come in and express their views prior to our developing a budget.
Is there support for that motion?
Before you vote, August 19th is not a date that we have on the schedule. I think you
Isn't
may
it?
mean August 14th, the annual meeting.
Right. We have,
Oh, I'm sorry.
August 19th is our first workstation
I'm
session.
sorry.
So I'd like
Yes,
to-
I understand.
As part of our conversation, I'd like to have a conversation with the public and invite them in rather than us being the only ones talking. So is there no support on the board for that?
Take no support, so therefore the motion
I'll
dies.
support it.
Oh,
Thank you.
support it.
I have a question.
All right, so we have a motion on the board to support
Wasn't going once.
discussion, Commissioner Elgar.
Yeah, we have a meeting and people can speak before and they can speak after. And they can attend, it's public, so what's the difference? What do you hope to accomplish in making it a hearing?
Well, the noticing requirements are different. To start with, for public hearing. I mean, so, and it's a designated, not a designated time during a meeting, but is actually a designated meeting, if you will, for folks to come and express. I really don't see the negative on it, but if other folks see a negative reason that would prevent that, then
So how many minutes have you given? We could be here all day.
then that's what will be.
well, it's scheduled from 3 p.m. to 6 p.m. That meeting.
Here at our public hearings, what is the normal time for, is there a time limit?
There's no normal time limit. It's your preference.
And if I could interject, we perhaps could eliminate the end time of these meetings and put them at 3 p.m. until adjourned.
Sure.
Except we have a meeting that night.
On the 19th,
That's a regular.
Yeah.
I'm sorry, is the motion August 14th?
Yes.
No.
I'm August 19th, I'm sorry if I said 14th, but it's our first work session, at which time we're gonna have a discussion among ourselves.
Any other discussion on that motion? Money?
Yeah, usually if an open meeting, you just, you open it up during, the meeting and then you have people come and talk about it and then you close it and it usually doesn't take very long. I mean, it could.
For a public hearing.
Yeah, for a public hearing. It can be within our meeting.
Essentially, all you would have to, yes, it would be within the meeting. All you would have to do is indicate that there is a public comment period that will be devoted exclusively to comments regarding the future budget. That would be what we would do. And
Advertise it and notice it.
And Commissioner Campbell is correct. It does require us a different type of notice when that is the case.
I guess my question, for any special meeting like that, we already have two public comments, one at the beginning and one at the end. I feel like that's statutory enough for them to offer public comment on our process. At the end of, once we air out how we want that process to be done, at the end of public comment, they get to show us their concerns as to what they don't like about it or whatnot. So I guess, or at the beginning, they could do that as well.
Well, it's noticed as a public hearing, which is more than just saying, we're gonna hold a meeting. And it says during a public meeting, the connotation is that we're asking the public, we're extending an invitation to the public to express their views, as opposed to, well, the public can show up and express their thoughts. We're taking the step of reaching out a hand and saying, please, come tell us what you think.
Is it possible to meet the noticing requirements, but have a time limit for public comments?
Absolutely.
Yes.
That's a nice compromise, I think. That's what.
Sure.
Can I just have a little bit more clarification on the motion? So you're requesting a public hearing set on August 19, 2025. On page 97 of the proposal, you have a work session between 3 and 6. Public hearing would typically be scheduled at either 6:30 before your nighttime meeting, or a public hearing could be held during your regular session.
It would be prior to our meeting.
So
We hear from the
want
public first.
Which
you
meeting?
want a
The 3 o'clock meeting. I'm sorry if I didn't say time, I usually say date.
well, I mean, there was 3 meetings being thrown around, so I just was clarifying. So you want a public hearing before the 3 o'clock work session?
Yes, or at 3 o'clock, and then our meeting will follow directly after.
Okay, so the public hearing would be scheduled first,
Yes,
and then that closes.
yes,
So you put a time frame of a start at 3 PM of the public hearing. And then your budget work session starts, it's noticed starting after
following the public,
the
yes.
public hearing.
Thank you, Jim.
You're welcome.
Okay, so my question is, if the public hearing goes 2 hours, giving us an hour or less?
That's all you get. That's correct.
I don't,
That is
I don't think
correct.
it's gonna go 2 hours, but anyways,
Well, that's-
our regular meeting could go 2 hours as far as that goes.
well, keep this up as well.
All right, so.
Go 2 hours.
If word gets out.
So we got a motion on the floor. All those in favor of that motion signify by saying aye.
Aye.
All opposed, say nay.
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 Okay, do a roll call.
All right, motion by Campbell. Commissioner Campbell,
Yes.
Commissioner Robbins,
No.
Commissioner Walter,
No.
Commissioner Wessel,
Yes.
Chairman Yoder,
No.
Commissioner Elguyer,
No.
Commissioner Bunning,
Yes.
3-4 fail.
I would just like to say that we welcome and invite people to come and make public comment before our meetings, and I don't
to item number B, which is declare surplus for expedition and a gooseneck trailer.
Yes, I think the EDS kind of speaks for itself on that. We have both the 2011 Ford Expedition and a 2017 Roadmaster gooseneck dual axle trailer that are no longer being used. We'd like to have them auctioned as occurred fairly recently for 5 other vehicles. We've actually concluded that auction, anticipated about $20,000. I think it was closer to
29 is what Lauren shared with me.
Yes. So we did fairly well on the last auction, and we expect to do the same on this as well. All right, motion. Mr. Money?
I move to recommend that the Leelanau County Board of Commissioners declare the 2011 Ford Expedition and the 2017 Roadmaster gooseneck dual axle trailer as surplus and authorize the administrator to sell the Expedition and trailer via the special auction with proceeds from the Expedition to account number 26606067300 and proceeds from the trailer to another account.
101-000-673-000. It's not that hard.
Supported by Commissioner Algar. Discussion?
That's a really nice trailer.
It's just not being used.
Yeah.
All right, any other discussion? Not, all in favor of the motion, say aye.
Aye.
All opposed, say nay. Motion carries 7-0. All right, next up, we have Parks and Rec proposed mission statement.
And it's not me. Can I go out of order for a second? I'm just trying to correct a document from the previous.
Oh, okay.
I just need, may I approach Mr. Bunning? Sure. I found a typo, but I'm not sure it's the one.
Down here, it's prevents.
I'm not good at finding titles. Thank you. I did find another one.
Oh,
Give me
okay.
credit for that. All right, thank you.
Well,
Sorry.
actually, Commissioner Campbell found it. I just.
Well, you know, he's a newspaper man. All right, sorry to interrupt. Thank you. I'll get it corrected.
Obviously, I didn't get a look at that.
Yeah. Taking care of that.
Yeah.
It ain't my type.
It didn't happen.
As to item 6C, I don't have a lot to add beyond what's in the EDS. At its June 18th meeting, the Park Commission voted to amend their mission statement for the county parks. And they make this recommendation to you rather than the administration. So.
Right, motion?
I move to recommend the Leelanau County Board of Commissioners adapt a proposed Parks and Recreation mission statement as presented.
Supported. Discussion, Commissioner Bunning?
Yeah, I'd like to amend that to exclude the last sentence. I do believe it's redundant and it, I would believe a mission statement should not have, should not include how they're going to do it. It actually excludes things when they give specific ways they're going to attempt to do it. They're excluding other things like sports or other things. So I would say that I amend that motion to remove the last sentence.
Work with that? All right. Yes. Any other discussion on the original motion? Okay, not, all in favor of that motion, say aye.
Aye.
All opposed, say nay.
Nay.
Carried 6-1. All right, next up, we're to item 6D, waiver of attorney-client privilege.
Yes, again, the EDS provides a fairly comprehensive discussion of what we're requesting is a limited waiver of the attorney-client privilege. It's limited only in the sense that It's to provide release of the June 9th, 2025 email from Attorney Nordford regarding the administrator's agreement. As indicated in the EDS, attorney-client privilege or the opinions of an attorney are exempt from public disclosure under Michigan law. And it requires your direct action to waive that privilege, because the privilege actually is owned by the county board itself. So a vote of the county board is required to take the action proposed. So I support the motion as presented and ask that you approve it.
All right, is there a motion?
So you do support it?
I do.
I move to recommend that the Leelanau County Board of Commissioners authorize a limited waiver of its attorney-client privilege, specifically limited to a voluntary public release of the June 9th, 2025 email from Attorney Nordford regarding the administrator's contract. Second.
All right, discussion? Mr. Money?
Yeah, I believe this is a redundancy. When that opinion was stated at our meeting and it was talked about, it was released at that point. I don't understand why we have to do it through this when we've already had it at a public meeting and talked about the opinion. But the other thing I see is I believe in that opinion, the wrong question was asked. It wasn't about employment with, and the wrong person asked it. It shouldn't have been asked by our administrator when it's about our administrator. It should have gone to either Mr. Howell or to the Register of Deeds or to another, or the clerk. So I just see it as a conflict of interest if the person asks about themselves to get an opinion. So our administrator was asking about an opinion about himself and his employment. So I do think the question should have been asked by, I would say, the clerk or our attorney, that did he violate his contract? Not his employment at Cherryland or being on the board. Is that employment? So I think by him, the question didn't get properly asked, so that, and the fact that the person who wanted the opinion asked it, kind of, it creates a conflict of interest right there. So I'm just really disappointed with how this was all handled, and I do believe that it should have been released as soon as it was brought here to the commission. And I also was disappointed that we didn't receive it as soon as he received it. It should have been sent to us immediately.
All right, any other discussion? Campbell?
Yeah, I agree with what's been said here. To me, as I see how this all unfolded, it really served to divide us because of the process used. We had a county board chair who received that on the morning of our meeting, and it was sent prior to. County board chair offered his opinion, but did not feel authorized to actually provide copies. And as I had talked later, didn't feel comfortable, he would let me look at the decision, but I couldn't have a copy of it. That divides a board. We all need the same information to be able to act in accordance with our beliefs. We have to have the starting point has to be the same. So I think it's a good lesson to learn that whatever we can get for information for one needs to go to all, and it needs to go to all immediately, as opposed to having it held or withheld or an opinion made of it or versions made. And that's water under the bridge, but I'm just hoping that we learn from that. And the more information we can all receive on a timely, the same information in a timely manner, the better we'll be able to act as a board. So that's my thought.
Any other discussion? All right, if not, all in favor of that motion signify by saying aye.
Aye.
All opposed, say nay. Carried 7-0. All right, next up, we got item number 6E, Housing Action Committee recommendation.
Yes, this item comes to you primarily after my appointment, but prior to me actually taking office as administrator, there was a motion, I believe a motion, or at least a discussion regarding disbanding the existing Housing Action Committee that is basically an adjunct to the Planning Commission or managed by the planning department as it currently exists. And I asked the board chair through an email to encourage you to wait to take any action on that until I was able to be in office for a period of time. I suggested 90 days, and it's been just a little bit more than that now, to evaluate what the situation is and what possibilities the county might be able to undertake to address the issue that we have regarding housing in Leelanau County. One of the things that has been impressed upon me back from even my time as the village manager in Northport is that there is indeed what can be very liberally characterized as a housing crisis in Leelanau County. The cost to live here, to buy a house here is prohibitively expensive for anyone trying to move into the county. It's become a very significant problem in recruitment for the county itself, particularly the sheriff's department, and simply burying your head in the sands and saying it's a problem for someone else to solve or to not solve at all is counterproductive in my view. So what I recommend is that you do disband the Housing Action Committee. I think frankly it's done. The research that it did is very useful and has informed a lot of the discussions that are occurring in the county, whether you want them to occur or not. They are occurring, and their work has informed that discussion to a considerable extent. I think you can accomplish everything that the Housing Action Committee was attempting to accomplish by assigning the county's response, such as it is, to the administrator's office to manage. So somebody can be directed to at least a particular office when they are looking for assistance and housing in the county, be it a developer, a planning commissioner from one of the townships, or just a business person looking to find a way to staff his operations. And then the third recommendation is, and I'm conscious of the fact that you wouldn't approve this at this meeting because we haven't been able to present to you the strategies that are being prepared by the Leelanau Housing Collaborative. But we would have that for you to review before your full meeting a week from tonight. Those are the three recommendations. I think they could all be considered separately if you chose to do so. But as I said, something needs to be done, and I think it makes the most sense to have that effort placed in the office of the county administrator. None of this that's proposed here would involve spending any funds that are beyond what's currently being spent for the Planning Commission, the Land Bank Authority, and the Brownfield Development Authorities. Two of which I sit on as voting members. that's another reason why I think it makes sense for those functions to be placed in the county administrator's office. So if you have any questions, I'd be happy to answer them.
Mr. Money?
Well, just, I would ask that we divide it into those three questions. I really think we should do each one separately. One would be, disbanding the Housing Action Committee. The other would be assigning, the coordination. The third would be endorsing the strategies. So I would make a motion that we disband the Housing Action Committee.
Second.
Approved by Commissioner Campbell, discussion? Commissioner Wessel?
I like the administrator's recommendations and they reflect a lot of work done at the collaborative. I remember, Will, when you and I were here, it was controversial when we had a housing committee. That was 11 years ago, 12 years ago. A lot has happened since then, and they had the Housing Action Committee that came up with a housing readiness checklist that's now been adopted by 5 different counties. I think the Housing Action Committee did a good job. Lois Bailey chaired that group, but I think it is time to move forward, and I'm pleased that I think the county and the Housing Action Committee played a big part in bringing Housing North, Peninsula Housing, and the Housing Collaborative together, along with the Leelanau Economic Foundation. So I just don't want this to be seen as well, we're admitting failure. No, we're admitting it's the next step. I've been participating with the administrator in the Housing Collaborative. It's been doing good work, and I'm sure when we see the strategies, we'll endorse those. I'm a little disappointed that we're moving to break it apart, just because I think the real intention was to, as you've been saying for quite some time, let's get rid of the Housing Action Committee. And this is not about getting rid of the Housing Action Committee. It's about using our resources and using the administrator's skill to continue on a housing progress. And so I'm going to vote no on disbanding the Housing Action Committee as a separate item, but if it were presented as a package, I would support this.
Mr. Money?
Yeah, I would, I just say, I spent some time with Gail yesterday talking about the Housing Action Committee to see if it really, what they were doing, and if she was in favor. She actually, talked about, she thinks it is time. She said, when they do meet, and they haven't met on a regular basis, when they do meet, they tend to go over the same things that they have, that they've accomplished, and they're going to do, that they have been doing. And so she said that it wouldn't bother her if it was disbanded, because the last few meetings, they've just kept going over the same things. So that, I mean, that was part of the reason. So I felt that was the reason I thought we could do that. And I'm not sure about the others, and I didn't have the information about the strategies, and so I didn't want to include them all together or vote for something I've never seen.
Discussion?
I think I was the one who brought up the Housing Action Committee. And I felt it needed to be brought up because it was on our agenda to reappoint members to that committee. And I knew at the time they'd only met twice in the last year. And my suggestion at that time was this needs a review, because like you said, it was getting repetitive. Members, they just weren't meeting. So you had to have a change. And I was really believing that something outside of county government might be more effective, such as is happening in Benzie County, where they have a separate organization that works independent of some of the confines, if you will, of government, as in private developers can talk more openly. They can. There are certain times where government can bog down the process. So that was my thoughts when I brought it up back in January.
Money?
According to our rules too, I do think it's going to take 5 votes for this, if it is to pass, because we had this at an organizational meeting, and I believe it failed at that time. So now we're into that, it has to take at least 2/3, I believe.
Oh, you're right.
Chair Algar,
I concur with Commissioner Wessel's statement that I think this motion is more comprehensive and reflects more accurately what we are doing here and where we are going, and I think that's important.
all right. Not, is there any other discussion? Not, all in favor of that motion,
Which motion could we clarify?
There's only one motion on the floor.
I'll ask the clerk to read it off.
Motion by Bonner to recommend to the Leelanau County Board of Commissioners to disband the existing Housing Action Committee, seconded by Campbell.
All right, all those in favor of that motion, say aye.
Aye.
All opposed, say nay.
Nay.
All right, motion failed 4-3. Mr. Schwasser.
I move that the administrator's recommendation along with the strategies be forwarded to next week's board meeting.
Second.
Moved and supported, discussion.
Yeah, I would like to discuss that. I don't know anything about the housing collaborative. Can you tell me what organizations are involved with that?
It's primarily a group that was created by the Leelanau Peninsula Economic Forum, I believe is the name. Foundation. It's the name of the organization, and it's a group of people that have been involved in the housing, in responding to the housing process for a considerable number of years, and through the facilitation of Housing North, has come up with some strategies that, again, they're not completed, but I expect they will be by the next meeting for you to review. But that's the essence of what the group is. It's a private nonprofit. It's not a government.
So it has bylaws, it's a separate group for, what group? Because I'm confused in that there are organizations that are part of this organization.
Now, it has members, yes, but I don't think there's other organizations necessarily that are part of the housing collaborative. There may be those that were asked to be a part of it because they are a member of a specific organization, but it's not like a group that has organizations that are member organizations. It is just a committee of the Leelanau Peninsula Housing Economic Foundation formed to discuss strategies regarding the housing situation in Leelanau County.
So this is actually deferring to the Leelanau Economic Peninsula Foundation. I mean, if that's the organization, I assume there's some type of an organization with bylaws and such as that. What is that organization?
That's the sponsoring organization, is the Leelanau Peninsula Economic Foundation. Yes.
Well, why? I mean, that isn't the name. We're sending this to a committee without an organization. If indeed this is just a committee of this overriding organization.
We're not proposing to send anything to them. What they're doing is providing a set of strategies that they're going to ask many entities, businesses, governmental entities, townships, and the county to endorse.
I mean, to me, it should be to the foundation, so that it's a government to organization relationship. And I don't see this. I see this as a committee, so an extra layer. It's been presented that Housing North is one of the members and Peninsula Housing is another member in publications. And I'd like to go to Housing North and have a discussion about that, because Housing North, we just finished a contract on June 30th with Housing North. It was a $50,000 contract, I don't know if Leelanau County received a report from Housing North following the completion of that contract?
Not to my knowledge, not, and certainly not yet. If they intend to provide one, they have not provided it.
I looked this stuff up trying to find out information about this group, then I understood that these member groups were how it was formed. And so I looked up the contracts for Housing North, that we finished a $50,000 contract with them. They're supposed to provide a report, and their main job was to preserve rental housing for full time. And I don't know how they did, how they didn't do. Their 3-year contract with us expires on August 1st. We're supposed to receive a report with every 3 months of their billing. I don't think we have any of those, but maybe we do. I don't know. I just haven't seen any documentation that says this is all about where we're going to spend our money and how we have spent our money, and making sure that where we spend the money, things are getting accomplished. And that's why I wish we'd have broke this down into 3 different parts rather than an overriding, well, geez, we got 4 votes, so we can push this through without discussion of the building blocks towards it. So I have concerns over, and I'll vote no on this because these should be taken up independently. We should know who we're dealing with. I think that this is a committee that we're dealing with a committee that is not incorporated. There's problems with this, and it got rushed to our table without the documentations we were told would be accompanying it. These policies, we're supposed to adopt these, recommend adoption, that's what this is, recommending adoption of policies that we haven't even seen. So I have no idea how anyone can vote yes on this.
We're just ordering it.
We're voting yes to recommend it.
Commissioner Bonnie?
Yeah, I've already asked for the division of the question. He's trying to put them together, and that can't happen once we pass for the division. It's just totally wrong. It's against Robert's Rules of Order. We have to do each one individually.
We're our own worst enemies here. We've got a housing crisis in our county. We asked the administrator to come back in July and report on his decision about the Housing Action Committee. That's why he was rushed, because we asked him to come back in July and do this. We've been working diligently with the Housing North and the Peninsula Housing and with the Economic Foundation and the Sleeping Deer Dune Council. And you're going to see the report, but we asked for it to be rushed. So let's not criticize the administrator for rushing it.
Not criticizing the administrator, what I'm saying is we should delay this for a month until we have the documentation in front of us. I agree, there's a severe problem out there. Rushing to cure a problem that's been coming at us for decades doesn't seem like a wise decision.
All right, Commissioner Walter?
Yes, we're making a decision without the information. So if we're supposed to have these reports, I'd like to have the reports before I make a decision. So, and the recommendation was to disband the housing committee. And that motion was set forth, and then we voted it down. That was part of the recommendation. That was the very first thing, to disband the housing committee. So that should have been a simple situation. The rest of this is, we don't know what we're saying yes to, because it's not very clear. Well, primary contact for all housing related inquiries for the assistance will ensure residents, well, who are the housing related industries, or
It could be anyone. And for example, I got a call yesterday from somebody that wants to build a house on vacant property. They need to know what the address is.
Wouldn't that be for the township to provide? the
No,
planning
it comes from the county planning commission.
Right, but the planning commission assigns the address. And then the township approves the plans of the house. They have their zoning.
The county building safety department approves the plan of the house, and that's part of the problem. That's part of the problem is you end up with a situation where I say, well, I can help you with this part, but somebody else has got to help you with this other part. And then a third person has to help with this third part of your problem. You have to go to four different, you have to go to the health department, the conservation district, you have to go to the building and safety department and to the plan and to the county planning commission if you're going to build on vacant property. All four of them. And there's no one person that you can say, this person is responsible for you to see that that process is smooth for an applicant. There's nobody that's that has that role right now. And I'm suggesting that's the second part, is to assign me to have that role, to take people's hand and say, you want to build in Leelanau County, this is what you need to do. And I'll be your champion to make that happen. That's what the second part of this is proposing. I agree that you don't have the recommendations, this recommended strategies of the housing collaborative before you. But that's one of the reasons that you have these two meetings. So you can have a discussion, the administration can find out what your interests and concerns are and address them at the next meeting. That's exactly why you have an executive board meeting and then a full board meeting to give final consideration.
All right, so I guess my understanding is, I do believe we have in our board rules that a commissioner can ask that a question be separated. So, I guess the motion that's on the table doesn't stand because it was requested to be broken up to. So I guess we'll do it in 3 different segments from my understanding. So as administration, I believe that is correct in our board rules. So,
Didn't that fail?
well, the first one did, but we got 3 different ones. So there was a commissioner requested that it be broken up into 3 different motions. And I believe that is in our board rules that can be asked of. So
and I would suggest that you simply, the next 2 motions simply be to pass each of those 2 other items to the full board meeting next week for plenary consideration.
So moved.
Support.
all right, so
That was for both of them?
that's for one, for the
To the assigned coordination to the administrator? Did you, and you had to have conversations with Gail, with our planning, the head of our planning department? And
Yes.
broached that with her and she was in favor of this?
I have not had that conversation with, but she's one of my direct reports, and we've discussed the housing issue at length.
Well, I know, but this is taking a responsibility from her office and reassigning it to your office. And
Which would be my decision functionally within the confines of the county administration.
Just makes
I'm
sense.
asking you to endorse it.
okay, I just would have felt more comfortable if she would have been part of the decision.
Mr. Bunny.
Yeah, and that's the same thing. I had the conversation with her. She didn't understand why it was being taken from her office. She spent all the time with the Housing Action Committee and now, and understanding it and, I mean, I got the feeling from it that, or believe that she really wanted it to be there. And I don't think, and I almost think that we're losing authority about housing if we assign it to the administrator. Sounds like that our authority is being taken away for housing. And I do think that it should come through the planning commission anyway, the person who's been at the meetings for the Housing Action Committee. And I would much rather see it at the planning. I do think our administrator has plenty to do, and I don't think he needs to get involved in questions about housing.
Commissioner Albert.
It makes total sense that the administrator can direct people to the proper channels. That's all he's doing, is saying, if somebody calls, I can tell them what hoops to jump through. I think that's what he's saying. Plus, in addition, down the road, we have an administrator with skills and experience in this area. But I don't see him usurping anything here. He's just, people call the county administrator with a question.
Any other discussion? Alright. I understand everybody's concerns here, but I will vote in favor of this simply to forward it to the next week's meeting so that we can get more clarification on that. And then we can
You'll go to next week's meeting, whether you vote for it or not.
Not
It'll
necessarily.
be on the agenda.
Not unless it doesn't, if it fails here, it will not be on next week's agenda. So, all in favor of that motion, say aye. All opposed, say nay.
Nay.
I have a question. Is the first motion was recommended by Wessel and Robbins to move the whole agenda item forward. Then it was mentioned that you needed to have it separated because Commissioner Bunnick requested that. But then Wessel and Robbins never removed their motion. And so do I have a new motion that you just voted on?
The chair ruled that motion out of order.
Yep.
And so then Wessel made a motion with who seconding for what?
When?
It was Commissioner Alguier.
Yeah.
To
Okay.
assign coordination of the county response to housing inquiries and requests for assistance to the county administrator's office.
So the second and third pieces of the original?
Well, it's just the second one. We haven't done the third one yet.
Okay.
It's literally just being broken up into 3 different motions because that's what was requested.
Right, but the first one failed.
Correct.
Okay, and that one passed 4-3? Is that what you said?
5-2.
Oh, okay, sorry.
I just like clarify that, I do feel that, that order should be, someone goes to the planning commission. She understands whether she can help or not help, and then if more help is needed, then she passes it up to the county administrator. I think that's just.
With all due respect, Commissioner Campbell, that's my decision as county administrator, so how the process with my direct reports works. That's my decision. And I respect your opinion. That is my decision as county administrator, is how that process works.
Well, I respect yours. I mean, it's before us.
True.
So you're asking us.
We already voted on that.
We just voted on it.
So I'm just explaining why I voted no.
We're gonna talk about it again next week.
All right, so now we have a vote whether to move on the last one to the next meeting, too, I guess. There's a motion for that.
I would move that we move the third proposal to next week's meeting.
Which is the endorse the strategy.
Endorse the strategies prepared by the Leelanau County House Collaborative.
All right, and who supported that? There was their support from Commissioner Wessel. Discussion?
I don't know how anyone can vote for it because we don't know what the recommendations are.
That's why we're moving it forward.
Well, and
We
to
got nothing to move forward.
for clarification here, I believe there was supposed to be a report at this meeting, but we don't have one, so that's why it's being forwarded to the next month, so the administrator can give a report what that is. So that's my understanding.
If you
Is that
prefer to
correct?
have it moved to the August meeting, we could do that.
I really would, rather.
This is your process.
It just doesn't make sense if you don't have it to move it forward.
Actually, we do that a lot.
And
I don't like doing that. I'm probably.
All right,
Make it right.
Commissioner Bunny?
Yeah, I mean, it's one thing if we have the information to read it, but if we get it the day before, we're not gonna have a chance to look at it anyway.
We do that in
So,
Doesn't make it right.
All right, Commissioner Wessel?
Well, I have seen much of the report we're going to receive, and I think it's worth taking some time on. I'd be very comfortable moving it to August instead of July, because I think it's something we must really understand. And it's well done, I think, but it demands executive committee discussion, not just board meeting discussion. So I would amend the motion to move it forward to the August
Second.
executive committee meeting.
All right, there's an amendment to that motion.
That's okay.
All right, oh, you're modifying your motion to this?
Yes.
Okay, so we're modifying, well, there's not an amendment, we're modifying the motion. Is the second okay with that? Mr. Waddle? All right. All in favor of moving that last item to our August executive committee meeting, say aye. All opposed, say nay. All right. So now the motion carries. So now the real question is, we only have one item for our next. We have one item for our next week's meeting, and do you want to keep it as that? Yes.
There's,
You just
there's
want-
that one, that's water under the bridge. no?
Oh, the housing action committee.
Right, the housing action
You have
committee
all
went down.
three items considered in August. There's be no reason why you couldn't do that.
Part 2 passed for next Tuesday.
Does that mean we're gonna have to go through this entire discussion again?
Probably.
Well, we'll have something to talk
It
about.
might be presented differently.
All right, Commissioner Bunny?
Well, yeah, and if we do move it, we would have to have 5 votes just to put the housing action even on the agenda. Now it's been rejected twice. It needs to have at least 5 votes to put it on the agenda.
The reason I voted no, I don't think the housing action committee should continue, but I voted no because I didn't want to do it just separate. I suggest we take the whole thing and move it to August.
All right, so,
You're gonna need a vote to do it.
all right, I guess we'll have,
So wait a minute, so
so,
how do we undo what we've already
all right,
done?
so,
We need supermajority.
so to clarify, to move to recommend that to disband the housing action committee, that failed. To assign the coordination of the county response to housing inquiries and requests for assistance to the county administrator's office will be on next Tuesday's agenda. And endorse the strategies prepared by the Leelanau County Housing Collaborative will be on the August executive committee session.
Right.
But to disband the housing action committee completely failed, so that still stands. So we'll deal with that. Everybody clear on that?
Yeah.
I know it's a 3-step process, but that's how everybody voted, so there's not much to do about that, I guess, so.
Right.
And I guess in August, when this to endorse the strategist, when that's on the agenda, I guess the administrator could have that back on the agenda for to disband the housing action committee if he so wishes, I guess, or somebody
Can we
could request
public
that, I
hearing
guess,
on
so.
I go yes.
All right, moving on to item number 6F, appointment of deputy medical examiner.
Yes, this is a statutory formality that you need to appoint as a deputy medical examiner those people that are used by the Western Michigan University Homer Stryker School of Medicine, Department of Pathology as medical examiners in both Grand Traverse and Leelanau County. This item dovetails into, but a report made in an issue raised in my report to you, where Grand Traverse County is also seeking a request for proposal to have the entire medical examiner process that they have handled through an RFP process. You'll see more about that at your next meeting, but this appointment needs to be made in order for this person to continue to work for both Grand Traverse and Leelanau counties providing medical examiner services.
Mr. Algar,
I move to recommend that the County Board of Commissioners appoint Dr. Nicholas Kostelecki as Deputy Medical Examiner as recommended by the Office of Medical Examiner.
or by Commissioner Wessel, discussion? All right, not all in favor of that motion, say aye.
Aye.
Opposed, say nay. Motion carried 7-0. All right, next up, we have 6G, which is emergency management. What's the amendment?
It's a routine approval. Your policy requires that out-of-state travel be approved by the board. It is a conference regarding the use of the Motorola radio systems that we, and dispatching systems that we have at the 911 department. It just happens to occur at Notre Dame University, just across the Indiana border, so it requires your approval.
I move to recommend to approve Matt Anscore and Kelly Frost of the Emergency Management 911 to attend the 2025 Midwest Youth Group Conference at the Hillsborough Library on the campus of the University of Notre Dame, Indiana. 8587.
Second.
Board discussion? Not all in favor of that motion, say aye.
Aye.
Opposed, say nay. Carried 7-0. Next up, oh, we got that here. Thanks for being here. All right, next up, we have item 6H, which is MERS delegate.
Yes, this is in October 16th through 17th is the MERS annual conference. We appoint both a employee member or employee delegate to go to the conference. And the employees have elected Molly Malinsky, with the second vote getter, or the second highest vote getter, Jim Stanchik, as the alternate. And we're proposing that I attend as the officer delegate, with Michelle Crocker, Jim Zwicky, or Jennifer Kane as possible alternates if I'm not able to attend.
Commissioner Wessel?
I move we recommend that the County Board of Commissioners approve Molly Malinsky to serve as the employee delegate and administrator, Jim Dyer to serve as the officer delegate at the 79th Annual MERS Conference on October 16th and October 17th, 2025 at the Grand Traverse Resort in Acme.
Second.
Support, discussion? Not all in favor of that motion, say aye.
Aye.
Opposed, say nay. Carried 7-0. All right, next up, we got item 6I, which is early childhood program.
Yes, and what I included as a late item was a proposals from the health department for possible additional tasks that they could perform as part of the early childhood program. You'll recall the last motion was to consider the use of these funds for possible vouchers for childcare and also prenatal care. We don't specifically address it in the report, but I've been informed by Michelle Klein that the prenatal care could be added without a modification of the contract and without additional funds, if we have an appropriate opinion from legal counsel that would be permitted under the millage. And secondly, the proposal regarding childcare vouchers was viewed as potentially difficult to administer. So they're proposing a infant car seat purchase and an unmet needs fund for approximately $56,000 each year combined. And Michelle is here and can answer any questions that you might have regarding that particular aspect of the proposal.
Commissioner Money?
Yeah, I'd like to move to recommend to the Board of Commissioners that prenatal care for the unborn child be added to the early childhood development program pending, council's approval.
Support.
supported, discussion?
It's just for this whole, just the one part of it.
That's just the one part.
Oh.
And that part we know they could do without adding any funding or anything to it.
Any other discussion? Commissioner Wessel?
I'm pleased that Michelle's here and we've been given a proposal, and I don't think we ought to deal with one aspect of it until we have discussion of the full proposal. So I know our board rules say we can separate the issues, but we haven't even identified the issues yet. Michelle, tell us about this program.
Yeah, so I'll start by saying, Commissioner Bunnick had reached out with some ideas on how we can connect with some more families in Leelanau County. Right now, we have about 45% of them that are involved in one way or the other. So, how can we connect with those other folks and support them? So we talked about child care vouchers. There's some logistical challenges. It's not off the table. I'm still hopeful that we can put something together that I can present to you next month. I think I come with our proposed budget for next year. So, but in the meantime, this sort of evolved in talking to Jim and some other folks around the community on what can we do when we have funds available? How can we best support our families out there? So one of the thoughts, every new baby needs a safe infant car seat. And so if we could purchase car seats for all the new infants, that gives us an opportunity to connect with those families, gives everybody a safe seat. And it's also, it's really expensive to have a baby, let's face it. And car seats are a necessity, but that would free up for all of our families a little bit of funds they can use for all the other things they need. So that's what's in here, and that we can try. So we've got 160 births in Leelanau County. Really they average from about 140 up to 180. So that's sort of an in the middle number. So we're anticipating about $36,000 a year, and we can give that a shot and see, see if it's received positively by the community. We also would like to send some staff to get the car seat safety certification training. This is a very, specific training you have to have in order to show somebody how to use a car seat in our day of, our litigious society that we have. So we would send some staff to do that so we can give some concrete hands-on support to families on how to install their car seats. And then the other piece of this is an unmet needs fund that we would just have available. We would budget it. Of course, if it's not spent, it would go back into, the fund balance. But just, if a family has dental care they need for their child, or if, somebody is sick and can't pay for their daycare for a couple of weeks and will lose their slot until they get back on their feet again, and those just kind of unmet supports that are temporary that we can, provide for our families. And I do want to be clear that wouldn't involve writing checks to individuals. It would be writing a check to the medical provider or writing a check to the daycare provider. So are there questions about or clarifications about any of that?
A follow-up, and this dental care that you've referenced here, that's in addition to the Smiles.
Yeah, we would flesh out the details of how the application process would be, but it would always involve connecting with other resources in the community and being if there isn't another resource that's available. So absolutely, we would be referring and working with United We Smile.
Any other discussion?
But you had $4,500 for car seat safety certification. I know you kind of winced at that too.
And the training itself is free, but it's like 5 days of travel downstate, of course. So to send 3 people for travel and lodging and food, it's kind of it's more involved than I would have expected, but it is, yeah.
That one gives me pause.
That's a one-time thing at least. Yeah.
Well, I know it's one
Yeah.
time, but
And
as a tightwad, I can't get over that one.
yeah, it's a little bit of a sticker shock. And we could set, I would like more than one person. I mean, it's nice to have an additional individual trained. It could be 2 instead of 3.
2 mixed.
That, and I'm fine with that.
It's lawsuits because we don't train people how to do it.
I'm not talking about that.
Right.
And we shouldn't do it
I'm not saying don't put in, I just don't know
All right.
about 3 people.
Any other discussion?
So would we repeat the motion we're going to be voting on?
Motion by Bud to recommend to the Leelanau County Board of Commissioners that prenatal care for the unborn child be added to the early childhood program. Seconded by Walter. That was the motion made.
I have a follow-up question, and I don't know what that means.
That means that we could start providing some support to folks when they're pregnant, families during pregnancy, instead of waiting until the baby's born.
Is there an amount associated with that, or? No?
I don't think, I think certainly, especially for this year, it wouldn't involve any additional funds. I think we could absorb, connecting with those women and doing home visits if they need it, or making sure they have prenatal care and health insurance and all the things. So, yeah.
So if we vote on your motion, then we still have one more motion to go to advance this.
That's what I was, so we need another motion to do the EDS then. We're making a separate motion aside for the EDS.
Yes.
Gotcha, okay. Gotcha. All right, any other discussion? All right, if not, all in favor of that motion, say aye.
Aye.
All opposed, say nay. Carried 7-0.
I have another motion.
All right. Commissioner Albert?
I move to recommend that the proposed modification to the early childhood program be advanced for further discussion at the full board meeting of July 15, 2025.
All right, it's been moved and supported. Discussion. All right, if not, all in favor of that motion, say aye.
Aye.
All opposed, say nay. Motion carries 7-0.
Okay.
Thank you, Michelle.
Thank you.
I think she should get a star for sitting through this whole thing
Yeah.
to explain that to
Well,
us.
I just passed.
All right, next up, we have review of financials.
Any specific invoice questions?
For our finance director. Guess not.
Okay.
Yes. So we have special reports by staff, commissioners, and affiliated agencies. Any special reports?
Does that qualify for me?
Yeah, absolutely. it
Okay.
does.
All right, I was just going to add, build on some of the things that were discussed today. As your finance director, I have knowledge of an opportunity for seniors that own their homes that fall within a poverty guideline. They can apply to their township for poverty exemption from property taxes. It's an annual application process. So if they need relief from property taxes, they apply, and it's by township. It can be either to the assessor or to the board. Each township navigates those waters independent of each other. So there is an opportunity for seniors to have property tax relief through a property exemption application. Also, Commissioner Campbell asked a question about working with LCN. The outside of Leelanau County Senior Services, Lena's department with regard to the millage, Senior Services has been a facilitator of the 2% grant process or the 2% allocation process. And they have been awarded monies through the 2% grant process for food insecurity relief. And that has been a contractual relationship, but it's not with Senior Services, it's with the board, but they bring it to your attention upon occasion if you want to know how we have done that with LCN. And I believe that when you were speaking about knowing more about MERS service credit purchases, I think it was the first year of the last board's term, there was a MERS presentation done via Zoom, and they had a representative that was on a Zoom presentation and answered a lot of questions about that, if you wanted to reflect back and see that MERS presentation again.
And not to take anything away from Michelle's presentation, but we recently, last month, you did approve an invoice and paid for certification of one of our deputies across the street in car seat installation. So I don't know which deputy, I can't remember who's certified, but I thought I'd bring it to your attention. That's just a little bit of information to be helpful.
Thank you.
You're welcome.
Same price for him?
I can get back to you.
No, I won't. That's fine. Maybe there's a cheaper place out there.
Any other reports? All right, I figured at this time I might as well give a report about, I know you guys approved for me to go to DC last month. Here, I'll just give a brief report on that. I ended up flying out the Monday prior to the meeting and came back the night, close to midnight actually by the time I flew back, so there's no way I could be at the meeting, but I guess there was an equivalent of about 75 people that were invited to the White House, and it was at the Eisenhower building next to the White House, so it wasn't technically in the White House. But it was pretty much just reports from 4 different secretaries, some interior secretaries, just what the administration is doing, how it's affecting the state, and they wanted input as to, things that are going on. There was 20-some county commissioners, and it ended up being 40-some legislatures. I had no clue that was, they never informed us of that when we signed up, that there was gonna be legislators there, so, but yeah, quite a bit of legislators there. We heard from HHS secretary, education secretary, HUD secretary, and commerce secretary. So they all gave reports on their different departments, what they're doing. Yeah, if you didn't RSVP, you're not getting on the grounds there. There's a lot of security there. So obviously with everything going on. So, but I appreciate you guys supporting me and going there and just being there on Leelanau County's behalf. And if anybody has any questions afterward, I'm happy to answer that. So. All right, with that, we will move on to public comments. You have 5 minutes. Kathy.
Kathy Dawkins, Leland Township. I'm just gonna beat a dead horse here just to say that, because I didn't get to finish earlier. I'm not necessarily against the proposal for flock safety. What I am concerned about after doing further research during the meeting is there have been numerous instances where law enforcement agencies have misused it. Police chief, 164 uses to go after an ex-girlfriend. Police lieutenant, same thing, went after an ex-wife using this program. Sometimes the license plates aren't read properly because of mud on the plate or something, to where there have been instances where people have been arrested, children in the car, everybody thrown down on the pavement, hands in. They were even trying to handcuff a child who the cuffs were too big, because it turned out that the plate wasn't even that car. It had been misread by this program. And it was actually the license plate that they thought it had read was a Colorado motorcycle, and this was a car in a different state. So things can happen. Nothing is perfect. Also, there's been a question about the sheriff mentioned that they do the permits. There is one state where I can't remember the state. I want to say South Carolina, but anyway, there's one state where they took away, they said no more of these come in, because a lot of them had been put out, the cameras have been put out without the permits. And that was one of the things that this flock says that we're going to do. We do all the permits. And he specifically even said that, the sheriff said that there's been times where they aren't doing that. Again, I don't have a problem with it per se if we do the research to know that it's not going to affect people in a negative manner when they would not have had that problem in the first place. Another problem is the feds, who are not allowed to use this program, they're using the term backdooring. What they do is they contact an agency of sheriff's department or city police, and they're using them to get this information when they're not supposed to. Um, We're people, we aren't always perfect. If this comes up again, I just hope that we have a little more information before it comes up for a vote, so thank you so much.
Thank you. Any other public comment? Yes, Mr. White.
Good afternoon, Commissioners. Hope you had a good Independence Day weekend. My name is Jim White. I'm a resident of Leelanau Township. I'm speaking today out of a deep concern over a disturbing pattern that continues to emerge under County Administrator Jim Dyer's brief tenure. Mr. Dyer has now submitted a proposal that would dissolve an existing commissioner-created Housing Action Committee, transfer all coordination of housing matters to his own office, and formally endorse strategies developed by an outside group, all without a single directive from this board to do so. This is not a routine administrative suggestion. It is a structural shift in policy that reorganizes county housing governance and expands the administrator's influence. Yet the initiative was crafted behind closed doors without direction from the board and without public discussion of whether such action aligns with the county's core responsibilities under MCL 46-11. Mr. Dyer is not a commissioner. He is not empowered to take the lead in creating, dissolving, or absorbing policy structures, particularly on complex issues like attainable housing, which, while important, is not a mandated county function under Michigan law. Frankly, this feels like the work of an eighth commissioner, one who wasn't on the ballot and isn't accountable to the voters. Hearing him tell members of this board today that you cannot tell him how to do his job, despite the fact that he works for you, reinforces that feeling. Employees should not be telling their bosses to stay in their lane. I urge this board to reassert your authority. Do not approve this proposal. If changes to housing policy are warranted, they should come through the board discussion, public input, and clearly defined processes, not through top-down directives from a newly hired administrator acting on his own agenda. The residents of this county elected the 7 of you to represent them, not to rely on one unelected administrator to decide for you. Thank you.
Any other public comment? Mr. Mikowski?
Steve Mikowski, Lake Leelanau. Good afternoon. For about 35 minutes in this meeting, we believe we've witnessed government by insanity on the housing issue. Some of the comments I made here are somebody is being ill-served. It looks to me like this issue was on this agenda much prematurely. Many of the facts that are necessary for honest and unbiased decisions were not present. Strange that we have a housing committee of some kind that only meets twice a year. Must be a tremendously important issue if they can only meet twice a year. And the statement was made here that we as a commissioner are our worst enemies. With this confusion type of issue being covered here, I think that it appears to us that maybe the commissioners are thinking that the enemies are the taxpayers. We're not sure. On another matter, we'd like to keep reintroducing and restating our request for a commissioner apology to the clerk and taxpayer resolution. Again, it was missing from this agenda. It's critical that this commission do this at once to salvage some of the 21-22 and 23-24 commission's credibility for posterity. Its apology is due to the May 11, 2021 Board of Commissioners clerk loathing motion decision that was put forth without a plan, no discussion with the clerk, no need, necessity, justification, benefit report at all. Its purpose was to remove immediately all financial and human resources responsibilities from the clerk's office, harming the clerk and the financial staff and wasting nearly $1 million of taxpayers' money. And further, what all this, it caused chaos in this building that has still ongoing, and you all know that. Thank you.
Any other public comment? Mr. Weaver?
Bill Wiesner, Elmwood Township. And this sign is more than ever relevant. One person, one ballot, one vote, one day. Makes it real simple. It's the only way to be assured of no fraud. Very simple. We can count here in northern Michigan. It should be up here. This handout is just 8 pages long. I've transcribed this talk. It's called Untamed. It's Joel Altman is the head there. Breaking Genocide and War Abroad to Keep Fraudulent Elections Across America Going. And so this is looking at the voting. This was brought up in an article, and Ed Solomon, he's the head guy with the data here. They won't use his name or the court case. He was supposed to be in court in June, but they've canceled that case. They won't use his name or the name of the court because I think they don't want people to know about this and research this. Also, Colorado has changed their cast vote records from the 2020 election to apparently hide what's happening in this vote. I'm thinking. The probability of this all happening is 1 out of 100,000 times 10 to some extreme number. It's impossible. And Ed Solomon gives a demo on this tape. If you watch it, the link is at the top here, right there. It's 2 hours and 20 minutes, but I mean, this is pretty definite that the elections are being manipulated at will. And Ed, he does a demo in 10 minutes. He downloads the cast vote records from the Colorado website. He puts it into Excel. He manipulates it so he could find all this information in like about 10 minutes. I don't have that knowledge in Excel, but I think maybe Kathy or Michelle here could do it, and it should be done. Because if it can be done out there with Dominion machines, it can be done here with Dominion machines. And what happened in Antrim County, our county, Grand Traverse with that Supreme Court election that already happened. So it's a little bit involved here, but if you watch the video, it's pretty clear. They're looking at on page 2, the repeal of Gallagher, which held the taxes down. The taxes went up 2 and 3 times after they voted this in. And that first graph on page 2, the lines for Trump voting increased. They should be flat lines. It's referring to Isaac Newton. It's not Newman, as it says here. This is a transcription. I didn't correct everything. It would take you forever. And but this is his math. When you do a probability like this or voting, it should be a flat line. It shouldn't be rising like this to vote for Trump. And the vote against Gallagher being flat, well, they held it down at 44%, 45% purposefully, so it wouldn't be suspect. It looked like everything was normal, but they had to do crazy things with the vote against Gallagher and such. I mean, this is just, it's in here. If you watch the video, the time stamps are on here. This little handout starts at the time stamp of 30 minutes, and it only goes to 43. Watch those 13 minutes and you'll get what's on here. And I hope to have the rest of it by next time. But he's got this seesaw thing. They held the vote. They wanted that vote to raise the taxes. They held it at 46% artificially, the seesaw thing on page 3. But they had to change. You see the first on the left here, the Republican is smaller. So he voted higher against raising the taxes. But when there's a Republican, the county is stronger, they voted less for it, 60% versus 66. There's a lot in here. It's all in those 13 minutes. Please watch it. And our clerk should be checking this too. Thank you.
All right, any other public comment? It's not, all right, we're on to commissioner comments.
Going back, and I'll make this short, it's getting late. But I think what happens with this housing, I much appreciate your report, the written report, really, I much appreciate it. And I think what happens is when, I'm not the housing guy. I don't go to these meetings. And so when you talk about the meetings, you're all ready to go and like that. Well, for the rest of us, we need to be, and that was possibly and hopefully where your report comes in, we need to be along for more than just the finish line. We need to be brought along as the sausage is being made to really have a feel for how we got to this particular place in time. And I think that that's part of what happened at the meeting tonight. Along that same, I wish Habitat for Humanity was involved in this organization. If I look around Leelanau County, they're the one group where I can say, okay, they did this, they did that. I know the others have a lot of plans, but to me, they've done a lot of work and deserve a seat at the table. And one other thing, just last thing, for the Parks Commission, we had a recommendation that we amend our budget for a project that is not on our agenda. Decision was made not to put. I just want Parks folks out there to know we haven't forgot you. What you guys do is important, and we just needed to discuss it more as a group. So that's it.
Mr. Robbins.
The comment I had there was Mr. Dyer is to check into, because I've been driving up the last 2 or 3 months, Governmental Center Drive there. I talked to the county commission, road commission, and they say it's our property, but I noticed that road started to, you look at the center line start to fall apart. So if that falls underneath our maintenance, we get something we gotta look down the road to
drive in from.
Yeah, the main drive from, okay. Yeah, I talked to Bob Joyce.
That probably is not.
Yeah, he thought that we owned it. So, but I mean, it's something that we should probably go into the budget, cut the cost down, inventory, chip it, save it for a few years.
2 compliments, and one was to the finance team. I know we're going to talk about the audit next week, but really good audit report. And Commissioner Campbell, I appreciate it, and I think you've set the standard for reporting on our boards. I appreciated that being in the board packet, and I urge us all to do a little bit more of the reporting out for our board assignments.
Yeah, I mean, I noticed the road thing, Commissioner Robbins as well, and I believe it's mainly because of the recycling trucks coming out. I mean, they haven't been, and that started what, 3 years ago, and then that's costing the county a lot, and it will be in the road repair mainly because of those trucks. I think. On top of that, I was out here the other day, and the parking lot was pretty full. And a person was putting in recycling, and at the same time, as they stepped out of their truck, someone came down the parking lot and almost hit it. So it probably doesn't usually happen when it's not very full, but at that point, parking lot was full, and somebody was recycling and somebody was driving down at the same time. And it just happened when he stepped out in front of his car. That the guy came to. So I do think we have somewhat of a dangerous situation there. I mean, it's really at particular times, but I also know that it's ruining our driveway at the same time. So I am concerned with it.
Rollins?
The background in road construction, we're owning a trucking company. It's not the problem, Mr. Mike, with their road. It's poorly designed. There's clay underneath there, and that's what's causing it. It's not the weight of the trucks. I know what the weight of those garbage trucks are. It was poor design, the way the road was, and it just needs to be corrected.
Commissioner Collins? Belgar?
I appreciate all of the incredible work done by people involved in trying to create housing opportunities. It is in-depth work. Some of these people work tirelessly. We cannot control that. It's a gift to us that we have people who are dedicated to this issue. So I support perhaps some updates occasionally, but they can create housing and opportunities. It's extremely complicated. Bless them for being engaged in that because it is tireless work. And I appreciate their work.
All right. Now I'll close out Commissioner comments with stating, I appreciate what the administrator's been doing, I guess, just to add to his plate a little bit more. I know Commissioner Robbins had brought up a couple months ago about the software. And I think as we're going into budget session, I think it would be ideal to have an RFP brought to the board here regarding that. Where we get to look not just at BSNA, but everybody, you know, to kind of have a full proposal in front of the board here to look at as we go into budget session. And then the other one is an auditor. My understanding, we've had the same auditing firm for over 20 years, and I just think it'd be wise if we would have an RFP on that to look into that as we're going into budget session. Maybe what we have right now is current, you know, is great. I don't know, but we just haven't done an RFP, from my understanding, in a while. And I just think it'd be wise as we go into budget session to have that in front of us where we can at least look at that and have the administrator bring some proposals or whatever, just go from there. So, but those are my, I guess, requests if you're able to do that. So,
I have one more comment. I appreciate our administrators' technical expertise and experience in housing. So thank you for your role in that.
May have one comment that I think you might want to consider, a change to your rules. I think one of the problems that you experience today, voting on something at a meeting like this where you really are making the sausage, as Commissioner Campbell says. When you know it's destined for consent judgment the next meeting, a motion is really, a pre-prepared motion is really appropriate. But for the two topics we had today, housing and what was the other one? Well, regard the ones that caused the most controversy and discussion, I would suggest what you might want to consider is have your rules permit for this meeting an item that is discussion only, with the end result to be a motion, the crafting of a motion that you will then consider for plenary consideration at your full meeting, rather than trying to shoehorn into the discussion of a large topic all the potential actions and motions and that should be taken. One of the things that I found most difficult doing the recommendation regarding housing is how do I make this all one motion and be in one EDS? And that probably was a mistake on my part. They should have been separate proposals. But I think if you were to have in your rules the notion that you're going to deal with a complicated issue at this executive meeting, and the end result that you want is not to vote on a motion, but to craft the motion that you're going to consider at your next meeting, I think that would go a long way towards helping you with these kind of discussions and the kind of debate. You craft the motion, and then you'll have that debate at your full meeting in a week. And it'll give you a full week, and even give the public some time to digest what you've discussed at your executive meeting, and then have it fully vetted with a motion that you all agree on that you're going to debate at your full meeting. I would just give that some thought as you, particularly as you enter the budget process, frankly. That's pretty much what you're going to be doing in the entire, for all these work sessions, is to have those kind of discussions where you'll craft a motion, or you'll craft a proposal that's going to end up in your budget in November. So keep that in mind, I guess. And I appreciate the opportunity to raise that issue.
With that, we will move on to approval of financials.
Post on ahead.
Yeah, sure. I would approve claims and accounts for $133,755.15.
Support by Commissioner Wessel. Discussion? Not all in favor of that motion, say aye.
Aye.
All opposed, say nay. Motion carried 7-0. Commissioner Money.
I would move to approve post audit $1,871,949.21.
Support. All right, supported. Discussion? Not all in favor of that motion, say aye.
Aye.
Opposed, say nay. Motion carried 7-0.
Thank you.
With that, we're adjourned.
We're on this one. Hey, I told you.